Good morning. On behalf of Ascenda Integrated Health and Ascenda Institute of Health Innovations, I'm happy to welcome you to this important and timely event. Merging Science and Safety, Addressing Gun Violence as a Public Health Issue. We caution attendees that today's summit may contain discussion which may be upsetting. If you find that you need additional support, please visit our website at www.ascendahealth.org. We do have on-site attendees who can help you and assist you with anything that you need. Please look for the orange scarves. My name is Rachel Green, Director of Diversity, Equity, and Inclusion, and Operations Coordinator at Ascenda Integrated Health. I'm here along with my fellow Ascenda team members to help make this a valuable day of sharing and learning. We are here to help you with anything that you need, and in-person attendees can identify us by our orange scarves. These scarves not only identify us as Team Ascenda, but most importantly, we wear orange to remember lives lost to gun violence and to raise awareness about this public health crisis. During today's event, all virtual attendees will be in-person mode only. And in-person attendees are asked to hold all questions and remarks for the Q&A segment. For all attendees, both in-person and virtual, the information on your screen currently includes a link which can be used to submit your questions for the panelists. I would like to extend a special thank you to our event partners, Gloucester County NAACP and Rowan College of South Jersey. Their contributions to this event have made it possible. It is my pleasure to welcome Loretta Winters, President of Gloucester County NAACP, to the stage to say a few words.
Good morning, everyone. Can you hear me? Okay, great. Just try my best. Okay, first of all, I'd like to thank Ascenda for bringing this very important topic to life, to our attention, and for Gloucester County Rowan College for hosting this event, this most important event that we need to hear about, and the only way that I think it can be cured. Gun violence is not just a criminal justice matter, it is a public health issue. Gun violence is a virus that's in our communities causing mayhem and destruction. And in addition to mayhem and destruction, it also injures many more people and maims people and provides them with disabilities for life. And when I talk about the disabilities for life, I'm not just talking about the physical disabilities, but there's a mental health issue too that's attached to it. The mental health of the family and the communities is so important with this. Thus, the effect of gun violence is a health one. It's the leading cause of premature death in the United States, killing 38,000 people and causing nearly 85,000 injuries each and every year. Once we recognize it as a health problem, we can think about it the way we do with other health problems. Today we will have a conversation on this very important topic. Again, I'd like to thank Melissa Fox of Ascenda and her colleagues for hosting this event and bringing information to the table that will assist us in this epidemic called gun violence. Thank you for attending. Thank you for being here, and welcome to Gloucester County.
Thank you, Ms. Winters, for those timely and very important words. Now, we will receive remarks from Acting Attorney General Platkin. Please look to your screen for General Platkin's video.
Hi, everyone. I'm Acting Attorney General Matt Platkin. Thank you to Ascenda Institute of Health Innovation for organizing today's summit on gun violence and for inviting me to participate. Gun violence is one of the most pressing challenges facing our nation and our state. It is a daily tragedy that takes lives, that threatens our security, and perpetuates feelings of fear and danger. And it's one that disproportionately impacts communities of color and other marginalized groups. As the state's chief law enforcement officer, ending the epidemic of gun violence in New Jersey is my top priority. Under the leadership of Governor Murphy and in collaboration with law enforcement agencies, we've worked hard to improve public safety from all angles. Last year, we created a statewide gun violence reduction task force and an intelligence sharing network to better lead investigations and prosecute violent crimes. We also organized the largest gun buyback events in New Jersey history, collecting nearly 4,000 firearms across 12 counties. And to address the recent spike in auto theft, which has been linked to other serious crimes, including gun violence, my office in the New Jersey State Police announced the expansion of the Auto Theft Task Force. And we made available up to $125,000 in federal JAG funding to ensure that the task force has the tools and the personnel it needs to reach its full potential. This investment is in addition to the recent $7 million investment we made in gunshot detection technology, alongside a $10 million investment in license plate recognition technology to improve safety and deter future criminal activity. But we know we cannot reduce gun violence unless we invest in both law enforcement and in our communities. As part of Governor Murphy's fiscal year 2022 budget, we awarded $8.2 million in community-based violence intervention program, funding 25 community organizations in 15 municipalities covering every region of our state. This historic investment will support community advocates who work tirelessly to address the pain people face in communities most impacted by violence. And it will provide desperately needed resources to victims and perpetrators of violence so that we can prevent future harm and suffering. Next year, we aim to increase funding for these life-saving programs to build on our efforts to stop violence. Our work is far from over, but we must continue to identify innovative strategies, engage in discussions such as the one we're having here today, and to support community organizations carrying out this critical work on the ground so that no one living in New Jersey has to fear for their safety.
Thank you, General Platkin, for those definitely kind and important words of information about the community. On behalf of Commissioner Jim Jefferson's office, he unfortunately was called away to an emergency this morning, but he sends his heartfelt support for the summit and looks forward to moving these conversations forward. Now we will transition to our summit, to Mrs. Melissa Fox, Ascenda's Chief Operating Officer.
Thank you so much, Rachel. So today is an important conversation. And, I'm expecting that it's not going to be the last conversation we have about this. And unfortunately, it's not the first in terms of gun violence and the effects that it's having on our communities. But I'm so excited that we have this amazing panel, both in person and virtually, to help us unpack what it needs to look like to begin addressing this as a public health issue, and then aligning across the country, across our state, and really moving this forward. This is serious. We all know this. So we really, I think, are all agreed, right, that we want to not just talk about it, but to be about it. And then how can we work together to change this so individuals and families don't have to suffer? So we're going to dig in. Y'all not going to hear me talk too much today, except to ask some very important questions. We want to hear from the audience, both in person and virtually, your questions for the panel. But I have some very specific things that I'm going to be asking you. And, I'm just going to let the panel know what I'd love for you to do. We have your bios posted online. So anyone who's interested in getting their information and how to contact them, please, you'll be able to access that. But I would love for the panelists, before you answer your first question, to just very quickly say your name so everybody can understand who they're hearing from, and then your role, just very quickly, and then we'll go into the question responses, okay? All right, so let's go ahead and dig in. So this first question, it's going to go to Lisa and Patrick. I want to hear from you on this, and also Solomon. So here it is. Over 40,000 people die every year from gun violence, and even more are seriously injured. In the US, people are 25 times more likely to be killed in a gun homicide than other high-income countries. So these are the high-level stats, but what does it really look like? What does it truly look like at the community level? So Lisa, I'm going to go to you first. What are your thoughts on that?
Hi, everyone. My name is Lisa Chowdhury. I'm the project director for the Patterson Healing Collective, which is Passaic County, New Jersey's first hospital-based violence intervention program. Thank you for having me here today. So what we're seeing in Patterson is that the areas that are most impacted by violence are usually the areas that are also dealing with a multitude of health issues, things such as poverty, things such as houselessness, things such as multiple health problems, things such as lack of investment, gentrification. So when we see in Patterson, the wards that are dealing with the violence the most are the first and the fourth wards. These are also areas that have new investments that are coming that are not buying into their own growth in that community. So we're seeing a lot of gentrification. A lot of the young folks that we're working with between the ages of 18 and 30 that are being that are victims, a lot of them are what we call couch surfers. They're dealing with frustration, they're dealing with trauma, multitudes of trauma. A lot of people talk about PTSD, but a lot of our young folks are dealing with complex PTSD. So when we look at, and it's not just in Patterson, I've been working with youth for a long time. I used to be a juvenile probation officer for about 10 years. And it's the same things that I constantly see. It's in the same areas that you're seeing that there's a lack of investment, a lack of culturally responsive mental health. Yes, there's mental health professionals out there, but our young folks need people that are empathic, that understand the cultural, their cultural identities, the importance of understanding systemic racism and how it impacts their lives and their communities. So locally, that's what we're seeing in Patterson. And that's what, when we talk about addressing violence, we're not just trying to, hey, put away the guns. We're saying, hey, what do you need? What happened to you? How can we help you? Let's look at the root causes and try to heal you from those root causes, and try to see how we can support you so that you're on this healing journey, not alone, but with us together.
You said some really important things, and Lisa, you said a lot of important things, and a couple things I want to come back to later, but definitely, asking that question, what do you need and how can we help you heal? So that's what's going on in Patterson. Patrick, can you talk to us about what's happening in New Orleans?
Great. First, good morning. Thank you for having me. Patrick Young, the Director of Gun Violence Prevention in the City of New Orleans. As Lisa was talking, I could have said yes to everything that she said. But for us, it's more like the aftermath of a destructive hurricane. Total devastation, total desperation, where you see people who are just trying to survive with nothing. I don't know if anyone ever seen Katrina and the aftermath of Katrina, when it's just dark and people are just moving without. That's how it feels. And you have these kids and these families who are living without. And so it's hard for us to do the work because we have to get that trauma in place. We deal with individual trauma, family trauma, social trauma, and the environmental trauma of just being and existing every day. You're trying to survive with nothing. So there's this desperation and devastation that's happening that we need to correct real quick.
And that's so powerful. I mean, desperation and devastation, and after the storm, it just conjures brings these images to mind of, like you said, people just wandering around trying to figure out, okay, where do I find safety? Where do I find shelter? And sometimes we think of the folks who may be committing some of these acts as, just criminals, but they're not. A lot of them are in pain, and they're trying to find their way as well. So that's something to think about as we're talking about this. In this first part of the summit, we're really focusing on, you'll be able to tell the communities and the community impact. So thank you very much for that. Solomon, I want to come to you to get your thoughts on that same question. What are we really seeing at the community level?
Yeah, I appreciate you guys having us here today. Solomon Middleton Williams. I serve as the Deputy Director for the Newark Community Street Team, where our theory of change is if we're able to serve as victims on the front end, like we prevent them from becoming perpetrators. And to your question, right, if 40,000 people are being murdered each year in America, we flip that around. We look at, there's around 321 people being shot every day here in America. And we talk about, services on the front end, right? When people are victimized, like, we're looking at 40,000 individuals or 40,000 families who have endured pain and they have no services on the back end. So to Lisa's point, right, we have to be able to invest within community, right? Last year, the president announced $5.2 billion to go invest into community-based violence reduction initiatives. But that is only a starting point, right? We need that, that $5.2 billion to go right into the hands of community. The community is saying, hey, we need these dollars, these investments. We have models, we have that are working across the country. We need investment, right? We don't need the money to go into government and sit for years and then get returned back in, because every time that happens, we are losing young men and women to gun violence. And so we need a strong investment. That's what the community is calling for. And we need an investment that is upfront and not reimbursable through most systems.
Mm-hmm. And you just touched on you're all touching on extremely important points. Solomon, there's something that you just touched on we're going to really dig into a little bit more, and that's the investment, right? And what does the investment need to look like, especially if we're talking about addressing this as a health issue and a health concern. So let's move to the next question. And Lisa, I'm going to actually come back to you first for this one. What are you hearing? And you've touched on some of this already. You've all touched on this so far. What are you hearing from community members about what they want or what they need to help address gun violence in their communities? What are you hearing?
So on the macro level, I already spoke about the housing insecurity and the fact that there's no investment in their communities, specifically in those wards that are dealing with poverty at length, right? But on even a micro level, some of the things that we're frustrated about is that young people have nowhere to go. Sometimes I look at our partners in Newark and I see all the different community-based organizations and safe spaces that they've created. They've created an ecosystem in Newark, right? Where young folks have a place to go to right on their blocks even. In Patterson, it's been difficult for us to even open up basketball courts, to the point where this year, with the funding that we got from the governor's office, we decided that we need to create these healing spaces in their neighborhoods. Young folks are hanging out outside because there's no recreational spaces, and not just recreation, right? Beyond just recreation, just spaces for them to talk, to process their emotions, to process the trauma. During the pandemic in Patterson last year alone, there were over 120 gunshot victims, right? That's just gunshot victims. Let's not even talk about how many shootings are happening. And these young people have nowhere to process that. And these are in just 6-block radiuses. So I just want you to think about that. This has been happening for a year. They're constantly hearing gunshots. They don't know if they're going to die, but they're still standing outside because sometimes there's trauma in the home too, right? So just on a micro level, we need more investment in these safe spaces for our young folks. In Newark, I know they have the Newark Trauma Recovery Center, and we need more investments like that. And those trauma recovery centers are not just for mental health spaces, but spaces where we can educate our young folks, right? Really build into them, give them the self-esteem they need, teach them conflict mediation. And that's just on a micro level. The macro level is, thinking about, once again, all the multitude of things that we're dealing with. So us as Patterson Healing Collective, yes, we have to think about all these macro level advocacy things that we're doing. And I just want to give you one example, and I hope that I'm not taking up too much time.
Absolutely.
I have a young man who is a gunshot victim that he is permanently disabled, right? And we have had to use donations, grant funding, all types of things to just house him because he has no family members. He's been incarcerated since he was 10 years old. He came home as an adult. He committed another, bad decision, and then he was incarcerated again. And then within 2 months of his coming home on parole, he was shot and permanently disabled. To this day, we have not found housing. And it's been such a struggle, and I just don't understand. I thought that there were more opportunities for those that are disabled, but he has a multitude of things hanging over him. He has a record, right, a criminal record. He has no credit history, and he has no social support systems in the community. And this is just, I'm talking about an extreme case, but I just want you to think about that, right? That if we don't even support our people that are disabled, how can we support, our regular young folks that are able-bodied, because we always try to penalize them or criminalize them when they're just hanging outside because there's nowhere for them to go. So I think that, when we're talking about these issues, beyond just locking people up and doing these get tough policies and gun buyback programs, if we use that same level of investment of just having safe spaces for these young folks, you will see miracles happen. And I've seen it, in just the year that we've been doing this work.
And the safe space piece, thank you so much for that. So safe space piece is important. It kind of comes back to what Patrick was speaking about, you know, trying to find this place within the storm. Tracy, I want to come to you and hear your thoughts on this as well.
Hello, my name is Tracy Huggins. I'm a registered nurse, so prevention is always with a pound of cure for me. But I'm also the founder of organizations known as Renewed Minds and Raw Wisdom LLC, where our focus is progressive services in compromised and disenfranchised communities and individuals. So when it comes to the question of what communities are saying, if they had the language to tell you, it would be everything that Liza said and more. We have to consider the social determinants of health that are impacting all of the communities, and they include income and social status, employment and working conditions, availability of jobs that actually pay a living wage, education and literacy concerns, childhood experiences, be they adverse or not. And with all of the trauma that exists in many of our most challenged communities, we tend to understate the importance of those adverse childhood experiences. Social supports or the lack thereof, coping skills or the lack of capacity to do so, healthy behaviors, which we know gun violence is absolutely counter to that, access to health services. We have to consider biologic and also genetic endowment and environment, gender, culture, and let's not forget the biggie and always the elephant in the room, race and racism. All of these things are systemically connected, and systems operate, let's not mistake it, in the exact way that they were created to. So we have this intentional us-them power dynamic, which lends itself to seeing it play out in the landscape of our communities. Community folk want you to do an observational survey of the land and consider the communities that have less gun violence and those that have the most. Just from a superficial level, you can see vast and stark differences, and we can all agree to that. Consider the Cherry Hills of our world, and then consider the Cumberland counties, Millville, Vineland, Bridgeton of our world, whereby we see stark differences in the school systems, the educations that are provided. We see stark differences in the streets and roads, the investment that Liza and everyone has already spoken about. We see stark differences in the way that the homes are outlined, laid out. We see stark differences in the amount of policing that is in force. Because while we are talking about investment, let's have the conversation. Increased police presence does not automatically equate to increased safety. Because if that was the case in Black and brown communities where people are being gunned down every day, we would see none of that. And so people want to be seen as valuable. If we start there, we would begin a tremendous wave of change when it comes to the way that communities can be seen as partners in the work to end gun violence where they live, work, and breathe. And we are not seeing that. There's a saying that we have in community advocacy among families who are connected with young people who are in the justice system. When it comes to those who are in positions of power and those who provide services and those who are coming to program and help, we don't need to see you eat the pizza because we can smell the garlic on your breath. The translation is, if you are looking to come in as a savior to people who actually have something of value to add to the problem, because those who are closest to the problem are also closest to the solution, then you are really negating any capacity to make any change. So communities want to be seen, heard, and valued. And they want us to really take seriously the need to compare the haves with the have-nots and then the whys behind that.
And you just said, you know, like I said, you all are unpacking a lot today. And look, and this is, let's just be, you know, totally upfront with each other about this. You know, we're having these tough conversations about a tough issue. And so sometimes we need to go to places that feel sensitive. But the wonderful thing about this conversation is we're having the conversation, we're having the discussion. And then that's going to open up so many ways for us to move forward. I'll bet today, with all the brilliant minds that we have on this call and you know, in this room, that somebody's already like, you know what, here we go. Here's a way that we can link some of these resources together in a way that perhaps we haven't in the past. So let me move forward, because you know what, they're going to start giving me the signal in a bit to wrap it up, Melissa. Okay, so this one, we talked a lot about the trauma, right? We touched on it, but now we're going to dig into that a little bit more, Jen. So I want to come to you on this, and Solomon, I'm going to come back to you too. So get ready. So if the effects of gun violence, we've heard, go beyond the incident itself, right? And it has ripple effects which can devastate families on many different levels. So can you talk about what that means? We're talking about the ripples and the effects that it has, and the types of impacts that we might be seeing, Jen.
Sure. Everyone, I'm Jennifer Kugler. I'm the director of our behavioral health services at Ascenda. So I come with that mental health focus. And I'm going to start with a story, actually a story that happened yesterday. So that lovely light in my car that says your tire is leaking air came on yesterday. And I said, oh gosh, here we go, right? Let me take care of this, because if I don't, then I'm going to be late. I'm not going to make it to the gun violence summit tomorrow. Something's going to happen. So I ended up stopping at a local store to get it fixed. And as I was checking out, I was reading actually some articles and some information in preparation for today. And the gentleman said to me, "Are you a teacher?" And I said, "No, I'm not. I'm in the mental health field." And he looked at me and he said, "Do you believe in PTSD?" Interesting comment, right? Interesting question to ask me. And I said, "I do." I said, "Do you?" And he said, "I think so." And I said, "Tell me what you mean by that." And he went in to tell me that at the age of 20, he had enlisted in the Army following 9/11. And that he had gone over to Iraq and Afghanistan and fought and lost more friends and more people that were close to him than you could ever imagine. And he talked about the impact of that. However, the realization of that impact didn't come until about 2 years ago, interestingly enough, when the pandemic started, and he really did realize the impact of his experiences. And he talked about everything from, not being able to sleep, to impacts with his relationships, to loss of relationships, inability to hold jobs, inability to kind of manage and control his impulses. He talked about, use of substances as a way to kind of cope with and manage the uncomfortable feelings that he was having. He talked about how every room he walked into, he was surveying, he was looking for exits, he was looking for cameras, he was looking for the people that were in the room. What did they look like? Did they look like someone that had tried to attack him previously? And he talked about how he had been trained to shoot to kill. And so interestingly enough, we wrapped up the conversation and he had talked about, the therapy that he had received and is still receiving through the VA. Talk about everybody kind of walks into your life for a reason, right?
Right.
And the impact that it had made, but he still wasn't quite sure whether he believes in PTSD. Interesting, right? When we hear about that and we hear about his experience. So it made me think a lot about today and a lot about gun violence and the communities and what the experiences are that they are going through. And we talk about this idea of trauma, right? And what does trauma actually mean? And so we're in New Jersey, and the Division of Mental Health and Addiction Services in New Jersey talks about trauma as this and related to gun violence. It refers to the extreme stress that overwhelms an individual's ability to cope. Individual trauma can result from an event, a series of events, or circumstances that an individual experiences as physically or emotionally harmful or threatening. It is not the objective facts of the event that determines whether the event is traumatic. It is the way in which each individual internalizes that emotional experience of the event. Traumatic events and circumstances often have lasting adverse effects on an individual's basic sense of self, their ability to trust not only themselves, but others, and ultimately their ability to feel safe, right, in the community and where they are. But it impacts their physical, their social, their emotional, every fabric, of what we are and who we are, it will impact. And so you can imagine that's just one situation, one incident of gun violence. But when we're talking about the communities that are impacted on a weekly, a daily basis, it does not stop. And so you talk about post-traumatic stress disorder, there's that word post. What if there is no post? What if there is no instance where the violence stops and you don't have the ability to feel safe and to heal, right, with mental health supports, if they exist, if there are enough of them in order to come to a place of healing? So that's just the individual. Then you talk about those ripple effects and that stone that you throw into the pond, that maybe sometimes it's slow or maybe it goes even faster and it gets to that edge, it does ripple and it does impact and affect everyone that it kind of goes through. And so whether it's the community that Liza was talking about, that 6-block radius, or whether it is the family that is, impacted by, whether it be witnessing, whether it be losing those loved ones and those family members and friends, or whether it be the stigma that's attached to some of that gun violence, right? We talked a little bit about that juvenile justice or that justice system. There's tremendous impact to that and stigma. And at the end of the day, grief is hard. Complicated grief, traumatic grief is even more complicated and long lasting without supports, help, and healing.
Wow. What if there is no post? My goodness, I had never thought of it that way. But that's powerful.
Yep.
Because it's difficult to start the healing in the midst of the storm. Keep coming back to the storm. Solomon, what are your thoughts on that?
Yeah, I want to try to be as brief as possible with this response. NCST, we launched and with funding from the state of New Jersey 2 years ago, the Trauma Recovery Center. And traditionally, the way clinicians or social workers get their clients, it's through like a referral-based process. It's either court-ordered, or they're mandated to go and get mental health counseling. When we opened our doors 2 years ago, we serviced over 370 clients who were walk-ins. Right? These are folks who are from communities who suffer from gun violence. The reality is that when services are presented to folks, to residents who are impacted, they are more likely to accept and receive it if it's competent, if it's place-based. And so, that's what's needed within our communities to address like this ripple effect of trauma. And I'll just close really quickly on a quick story, right? I did a panel about 2 weeks ago, and I met this young man, and I asked him to imagine a world where there was no violence, right? Imagine a world where there's no violence and what this world would look like. And he couldn't even imagine a world without violence. And so I asked him, I said, hey, have you ever been shot? He said, no. Have you ever been robbed? He said, no. Do you know anyone who's been robbed, shot, murdered? Like anyone? He said, no. And the reality is that when we talk about 40,000 people dying of gun violence, this young man who's 11 years old, right? He's thinking about those 40,000 and he cannot create safety within his own mind. And so I think I hear people talk about this word, violence in Black communities. We saw Black on Black violence. We've seen gang violence. We've seen youth violence. Now that we're talking about it's an epidemic, like, let's be honest what we're having, right? We're at war within our neighborhoods. And the reality is that we have a full-on pandemic within concentrated neighborhoods, right? And when we look at it, Lisa laid out, look, we're at a 6-block radius. In the city of Newark alone, right, violence only occurs in 20% of the neighborhoods. But the entire city may feel like, hey, violence is happening everywhere. And so we must really stop misnaming what's happening. And then again, as we talked about earlier, make a deeper investment so that we can combat the mental health that comes from violence.
Wow. Y'all gonna make me have to have another summit because we're touching on some really, really important stuff here. I want to come back to something Solomon touched on. I just made a couple notes about that, but I want to switch gears for a moment. And I want to talk about social media and gun violence. So as a world, we're learning real time the effects of the social media experience. Y'all may be able to tell, but I'm not 15. I'm not in that age cohort that's kind of grown up with this. So I've actually seen it grow, seen it evolve, and can remember a world when social media didn't rule everything, every perception around you. So we're really going to be learning about the effect on this. And there's some studies already starting to come out about what this means in terms of self-esteem, et cetera. So what connection, and I'm going to come to 4 people on this. I'm going to start with you, Patrick, on this, because I know you're doing some really interesting work in New Orleans on this. But what connection do you see, if any, between the rising gun violence and social media? Now, let me just kind of put this out there. I'm not blaming social media. We're not blaming social media for gun violence, but we are examining potentially that intersection and what that could mean. So Patrick, what are your thoughts?
It's 2 parts. So first, there's a quote by Ralph Ellison in his book, Invisible Man, that I'm only invisible because you refuse to see me. And in that quote, you see with social media, here's a place where I could be seen, where I could be liked, where I could get the attention that makes me feel important. But then you also see people who have no identity find a likeness or avatar on these social media platforms where I can pretend to be something that's like imposed to my own reality. So if my reality is dismal or poor on social media, I could be rich and alive, right? And what we find is that when we do community outreach, like Lisa was saying earlier, going to neighborhoods and see kids hanging out, they're not hanging out in those places. They're not hanging out behind the school. You don't find people behind at the mall, but they're on social media platforms. And so we have a digital community that we have to look at, not just our own reality community. And so we started a social media violence intervention program in New Orleans. And what we found real quick is the amount of drugs, the amount of guns, and the connectivity between certain age groups is where they get to be liked. And I get to be seen because my parents may not be home. My school dismisses me. Some of my friends are close proximity where if they're doing it, I need to do it too. We have a generation in New Orleans that been incarcerated, so we lose a lot of fathers out of homes, families broken up, mom may still be working. So where do I get to, where can I become something of value? And isn't it social media? And so for us, it's trying to find a way where we can intervene and change that behavior before it turns violent.
Wow. Wow. And that's so, having young kids, well, they're older now of my own, and watching them go through this, it's amazing how much influence there is in social media. Jen, I want to hear from you, just from the mental health professional's perspective, on what that intersection could or may look like. And David, then I'm going to come to you next.
Yeah, so I think similar to what you said, Patrick, right? Twofold. Certainly social media has had some negative impacts on mental health. As Melissa mentioned, there's a lot of research that's noting that, but it allows also for quicker connectivity. Information travels light speed, much faster than I think any of us can kind of keep up with. And it's hard for, young individuals to kind of keep up with as well. But what our kind of communities are seeing is that there's also situations that can escalate online and through social media very quickly. And because of that, it kind of ups the ante a little bit faster than it used to. And also, like you said, Patrick, right? I can be seen through this and by this in what I'm posting online, and what I'm kind of experiencing online as I go through that. And what we're seeing is a catalyst, and we're seeing things just travel much more quickly. Now, interestingly enough, as with anything, social media can also be an opportunity for not only kind of research, but the opportunity to become involved and invested in a positive way. And I'm sure we'll get to some of that too.
Absolutely. So thank you for that, Jennifer. David, I'm going to come to you, but I would love for you to, since it's the first time that everyone's hearing from you, just take a brief moment to of course, say who you are and your role.
Sure. My name is David Mohammed, and I'm the Executive Director of the National Institute for Criminal Justice Reform. We are based in California, but work throughout the country, and appreciate Eliza for being on here. I grew up for the first few years of my life in Patterson, New Jersey. And we work around criminal justice reform and gun violence reduction in several cities around the country, and which includes a partnership with the White House now that Newark is a part of. And so the issue of social media, you said you wouldn't blame social media. I'm close to go ahead and blame social media. So what we see in cities throughout the country is very similar. It's eerily and scarily similar situations of street conflicts being escalated and playing out on social media. And in fact, you could take an incident of a shooting and back up and see it play out on social media. In fact, I think Columbia University is trying to use some algorithm to predict shootings based upon social media posts. But what we see in several cities around the country is certain conflicts. There may be neighborhood conflicts or crew conflicts. Many of them are conflicts over a young woman. And so two guys are in conflict over a young woman. They may also be connected to some neighborhood cliques, but they are having social media disses at one another, and that escalates and it escalates and it escalates, and then somebody is shot. And so the social media that we see played out in all types of things, politics, where folks are a lot more open to disrespect one another, to say some of the most egregious things about one another. We see that in everyday politics, but the same thing is happening around street conflicts, and you add the easy availability of firearms, and you have these social media beefs playing out in real live shootings on the street. The other thing you have are you connect that to some artists who are putting out diss songs about individuals or about crews on social media. That exacerbates conflicts, and many of those have turned into real-time shootings in many cities around the country. There are now these videos that you can see that are dissecting some of these conflicts, some of these music clips that have been put up there, and how they result in shootings and sometimes wars. And so that's the horrible part about it. The good part about it, as you know, we heard from the brother from New Orleans, is there is this opportunity to intervene. You see this play out prior to the shooting. So we can get ahead of it if we're properly resourced and on top of it, which takes a lot. But I think we have this opportunity. It is a significant problem and challenge, but it also provides an opportunity to be not just aware of it, but to try to get in front of it and intervene prior to these social media conflicts escalating into real shootings.
And that's a very good point. I mean, there is an opportunity, and I think you both touched on it. Jennifer touched on it, and David, you just touched on it with, you know, it's a good and a bad to it, right? I mean, it's something where we can, if harnessed properly, it could be used, as Patrick mentioned, to help to address the issue. Tracy, I'd love to get your view on it. What social media and gun violence, what do you think?
I'm very glad we didn't have social media when I was growing up.
Right.
Because when you're young and you're not thinking about what the future may hold, and you're so bold and you're so brash that anything and everything will come out of your mouth. And that's exponentially the case where we have young people who need to be validated. And so when we have social media, many folks seek and actually become addicted to the levels of actual increase in serotonin that they get, pleasure senses from the likes. The lack of likes has been statistically proven and data proven to be connected with depression. And so when we have young people who are living in this perfect storm of a world where they may be coming from a place where they are not seen, where they are not heard, they are not valued. And then I have this opportunity to create this space, as Brother Patrick just spoke about. And I can be this amazing person. I can be the man. I can be the woman. Because let's not mistake it, our women are sometimes, our young ladies are much more violent when it comes to acts of this nature. But when we need to be seen, and the only place that we can be seen is in a negative platform, we'll take it and run with it. Any attention is good attention when you're seeking it and you're not thinking. And then when it comes to the adolescent brain development, which now lends itself to 26, 27 years old, we have a just continuation of all of these negative things. So I am loving the fact that there is opportunity in this, but I think it's incumbent upon all of us to be much more diligent in how we approach it, and to also know that we're not going to program our way out of this situation. What we are going to have to do is be very, very intentional and very strategic in how we approach each and every situation and not put people in boxes.
That's right.
Melissa, can I
Yes,
add
please.
one more
Absolutely.
thing to it?
Absolutely.
I think it's also important to know that there are people who get on social media just to watch. And so why do you feel compelled to follow Because in order for you to be observing someone, you have to be a follower. Like they even have it on their followers. And so why do certain people feel a need that I have to follow this?
Right.
Even if you're not commenting, even if you're not posting, you wake up following this type of imagery. If you want to see what we see, use the hashtag drill music. And I'm not saying that the music is the root cause, but look at the following, right? One of the highest artists on YouTube is NBA Youngboy, who has the largest following of any person ever on YouTube. Drill music, and his name NBA Youngboy. But this music speaks to so much death and destruction. So why do people wake up wanting to follow this?
Right. Right.
And so that's going back to your point. What if there is no post?
Right.
What if there's a place where we exist that this is what I want to see every day? So,
Wow.
It's a state of crime.
Melissa, can I jump in really quick?
Please.
It's all just really quick. So the drill music piece. So for those who don't know, that's the censored version of what's happening here. The real word is kill music, right? It's intended to kill, right? And we think about like music. When we think about when popular positive Black music was coming out in the 70s and 80s, we were censored as Black people. Let me just say that again. We were censored, right? And then somehow people start making money, right? Some people start making, Black death look cool, right? And yes, so we put the ownership on social media to censor Black death. They making Black death look cool, right? And so we have to put the ownership to censor these social media outlets. You think about like world star hip hop, right? Like financially, it's genius, right? We post stuff online, people watch, right? As the brother said, people just watch it, right? And they gain revenue. And there's nothing stopping them from gaining revenue because, it becomes lucrative to people. And so, yes, people are accountable. They should be held accountable. And we need to censor what's being put on social media and other outlets.
And that's, first of all, you touched on an important point. 70s was good music. I will, challenge anybody who says otherwise. The 70s was good music. And I think that the ability to be able to ask that important question of why is that important to feed into you? Like, where does it begin? And I'm kind of looking at Jennifer here, and I'm looking at Tracy just from a healthcare perspective, from a medical perspective, from a mental health perspective. What is it? Where does that cycle begin in terms of that is where you go to have some sort of validation, or have that release of serotonin, or where does it go? So yeah, we're gonna have to have another summit, I think, just to unpack that piece and the social media impact on violence and the perception of violence. So I want to switch gears just a little bit because we're touching on it, but just to go into what are some of the more successful interventions we've seen at the community level, and why do you think that they were so successful? So Patrick, you touched on a little bit from New Orleans, so I'm going to come back to you first on that.
Great, thank you. Again, I'm the first director of gun violence prevention in New Orleans. For over 30 years, New Orleans has been in the top cities of violence around the world, actually. And we have the highest incarceration rate. We know that. And then we have the highest number of people returning. So we have the highest recidivism rate as well. So there are many outlying problems. When we started the ceasefire, kill violence model about 12 years ago, we had credible messengers. And what you find, though, with the credible messengers sometimes is that people play both sides of the fence. So this year, when we started our Office of Gun Violence Prevention, I wanted to take a different route. So I launched the first Barbers and Beauticians Collective Fellowship, where we train barbers and beauticians how to be conflict mediators and interrupters in the city. These are people who are leaders in their community, are stakeholders. So no matter if you're the governor or the gunman, you're going to get your hair cut. No matter if you are the woman that's fighting on World Star or a school principal, you're going to get your hair done and your nails done. And so when we invoke these leaders to become peace ambassadors in the community, we've seen them reach the community that even our conflict interrupters couldn't reach. And then also they're stakeholders. You can have a conflict interrupter, a mediator that can go in the community who have ties to that community. But what if that person leaves? Those relationships leave. But if you have a stakeholder is there, that barbershop that's there, that beauty salon, they're going to be there because they've been there.
Right.
they can de-escalate the situation better. I give the example, sometime if someone is in the shop and they have a heart attack, if nobody's trained in CPR, it can turn fatal. Well, if there's an argument that starts in the shop and nobody is trained in de-escalation, it can also turn fatal.
Right.
So you need someone in a presence in that immediate community that can de-escalate, intervene, and interrupt before something tragic happens. And so what we've seen in our first cohort that we graduated, we had 13 business owners who completed our fellowship. But since then, they've hosted over 8 peace initiatives on their own.
Wow.
And so by empowering the community, we empower collective impact as well.
That's wonderful. That's absolutely amazing. David, what about you? What are some of the successful interventions you've seen, and what made them successful?
Yeah, part of our work is to both research to understand what are effective, particularly community-based violence intervention efforts, as well as help to provide training and technical assistance and implementation for these efforts. And so I'll first start with some of the principles and then briefly talk about a couple of jurisdictions that have been able to do this effectively. First, you have to understand what your objective or your goal is. And as simple as that might sound, we've worked with so many jurisdictions that fail to understand this, is what are you trying to achieve? Are you trying to have prevention and work with younger folks so to stop them from being involved in violence in 5 or 10 years? Or are you trying to have significant community transformation? Somebody earlier talked about the different neighborhoods in a city, some that have no need for violence intervention effort, and others that have great desperate need right now for violence intervention efforts. You have that in the same city. And when you have a community transformation, you want deep investment in communities, neighborhood revitalization, education, improvement, economic development, all of those things that are near to dear in my heart. But then there is intervention. And that is, we want to reduce gun violence now. We want to reduce gun violence in the next 6, 12, 18 months. And each of those types of violence reduction efforts are all worthy. None is better than the other, but they all are different. If you see, and just give me a moment here, if you see an old adage, if you're walking by a river, if you see babies in the river drowning to their death, your natural instinct is going to be to jump in the river and save those babies. If while you're in the river, you look upstream and see an evil man putting babies into the mouth of the river way upstream, you might want to jump out, go tackle the guy and stop him from putting babies in the river. If it's just you, it's an impossible choice because it has to be both and. We have to save the babies drowning in the river right now and stop them from being in the river, so that you need people to do both. But those are different activities that have a different time frame. And so we need to understand when we want to have intervention in gun violence, if we want gun violence to stop now, that means we have to work with the individuals who are at the very highest risk of being in gun violence right now. So one, we need to know who that is. There's a lot of misinformation about that around the country. You need to look at your local jurisdiction, understand who are the people involved in gun violence now. One example is we always think about children or young people or teenagers, and almost in every jurisdiction around the country, less than 10% of all shootings involve people below the age of 18. So we're primarily talking about people 18 to 35 years old. The other piece around that is so focusing on the right people intensively with people who have credibility, who have similar lived experiences, who have been trained to work with this population and work with them intensely. And so what we have found is if you have people who have credibility, who have similar lived experiences and have been well trained and work with this population intensely, that you're going to connect with this person every single day. You're going to work with them intensely over the course of 3, 6, 8, 12 months, 18 months. You're going to first develop a positive and trusting relationship with them, and you're going to help them connect to needed services. But sometimes in that sequence, because the folks, when we meet and connect with a 24-year-old with 7 previous arrests, who's a vowed member of his neighborhood clique, and what he's doing most days is looking for his enemy. This isn't a person like signing up for services somewhere, but this is a person who's experienced trauma, who is wanting, he may not articulate it, but wanting a relationship with somebody that's positive and trusting that can help him. And so the first thing you're going to do to him is not say, hey, let me sign you up for a job service. So let me sign you up for this group. The first thing you're going to do with that person is develop a deep, positive, and trusting relationship to then connect him to needed services. So with that, quickly, we have seen this effective in several cities, and I'm sure Solomon can talk about the Newark Community Street Team. We've seen in Oakland, California, this gun violence reduction strategy have 7 consecutive years of reductions in gun violence by pinpointing the individuals at highest risk of gun violence, have outreach workers connect with them, and then hand them over to intensive life coaches. These life coaches have no more than 7, 8 people on their caseload. They talk to them every single day. They see them 3, 4, 5 times a week in person. They connect them to needed services. When you have that type of structure, that type of intensity, intentionality, and well managed, then you can see significant reductions in gun violence.
And if we have some time, I want to definitely come back to that pinpointing strategy. And I think you both touched on it because I think it's really critical. But I want to come to Tracy first for what interventions have you seen that have worked really well, and why do you think they were so successful?
One of the most powerful interventions I've seen occurred in the Bronx and is now occurring in Camden, New Jersey. And that was with establishing a restorative justice culture and nature and practice among the community. And what that involves is the actual identifying of a 3-part process, because we have to identify who was harmed. Then we have to identify what harm was actually done. And then how do we repair the harm? And that involves perpetrator and victim and a skilled facilitator who is intentional about the process, guiding the conversation and building. And that takes time. Relationship is at the core of our healing and our restorative nature. And unless we are coming into this with a mindset that is focused on building those relationships that the brother just referenced, we're not going to be effective, because as he said, the 24-year-old with the 7 priors is not looking for the job, he's looking for his enemy. And we are not, again, going to program our way out of this. We are operating with folks who are in a state of scarcity and chronic stress, not post. Chronic stress. So it's active, it's occurring now. Building that relationship is key, but that restorative culture does so many things because it builds up the awareness of my place in the world, my connection to my fellow human being. And then the accountability factor that is often missing is allowed to not only be owned and named, but made a part of the ongoing conversation in the relationship building. So I am a huge proponent for restorative culture as a healing mechanism, and it works, but it takes time. So this is an opportunity for dollars to be reinvested. Yeah,
perfect. Thank you so much. And I want to remind everyone that you can start to get your questions together. We're going to have a Q&A on the back end. So if you want to get a little bit more information about what we're touching on or just some more clarification, please start to submit your questions. I believe that we can do that. So David, I'm going to come to you specifically for this next question. And I want to talk about mass shootings, within this context. So we've seen an increase in mass shootings as well as the person-to-person gun violence. So is there a significant or fundamental difference in the causes of these types of incidents versus the others? And then also, is there a difference in the interventions that communities can and should use to address any potential risk?
Yeah, so this is slightly tricky because most mass shootings, when you look at the definition is an incident where 3 or more, 4 or more people are shot. Most mass shootings are the everyday urban violence that we see across the country, not what we think of when we think of mass shootings, which are the Dylan Roof and the school shoot, or all of these pieces. And because those are a bit different, right? The mass shootings that we conjure up when we hear that term are largely white men who have guns who are going in to shoot up something, either a church, a school. Often, schools are one of the big things we think about, and that is somewhat different. The similarities, there is the easy access to guns. There is some aggrieved person who is in trauma, who is playing out their significant challenges and trauma out on others. But it is pretty different than the kind of more regular, which should never be regular, but more regular mass shootings that happen in our communities. And we talk about root causes. When we think about the violence that largely affects Black and Latino communities across the country, we're talking about decades of disinvestment, decades of communities very deliberately lacking resources, lacking opportunities, not having economic development, some of that created by federal law in the past that continues to hamper the growth and development of these communities, really poor and low standard schools. And so you have whole neighborhoods that have been affected by concentrated poverty, by low performing school districts, hampered by blight, the easy access to guns and drugs, the proliferation of liquor stores. And so you have these neighborhoods that our people are growing up in, and it's to the resiliency of our communities that most of the folks in those communities are not engaged in violence, despite some popular uninformed opinion. But we have those circumstances, and on top of that, then we have easy access to firearms. We've already talked about the social media, and you said all of this boiling over to people who are in great need of healing, in great need of support, who have significant lack of resources, who have been, their outcomes have been made worse by system involvement. And then they play out violence in horrible ways. And none of that is to excuse it, is to better understand it. And different from the 25-year-old young white man who feels aggrieved, feels like something is happening to his privilege and position in society, takes a gun and plays it out. So those are very different. But what makes it tricky is when we think about just mass shootings, period, most of those actually occur in our communities, and not these big sensational cases that we see in the media.
Okay, thank you. Thank you very much for that clarification. Okay, so then let's talk about, we've talked about different types of interventions, talked about the partnerships that need to happen. We kind of touched on that a little bit, the stakeholders. So I'm going to come to you on this one, Solomon. Is there enough coordination across the communities, even across state lines, some of the things that we're doing here today, where we're sharing ideas and experiences regarding what the right interventions or proper interventions should be? And if not, or if so, is this helpful? Would this be helpful if it's not happening? And what, in your opinion, would the ideal scenario look like?
Yeah, I appreciate the question. I don't think there's enough communication happening, the appropriate communication happening around this issue when we talk about gun violence in Black and brown and poor neighborhoods. I don't think we're drawing enough attention to it. We've seen other parties draw attention to, we look at Brady, and we're looking at, these are our colleagues, right? We're looking at moms. We look at these institutions that, was talked about earlier. These things are established institutions where they have dollars to raise awareness of what violence and survivorship looks like within their respective neighborhoods. We're talking about Black and brown communities who do not have the investment, do not have the infrastructure, do not have the systems to support their healing journey. And so, again, I don't think we have enough coordination within these respective communities, because people do not know how to advocate effectively for themselves when it comes to victim services. The reality is that we did a study here in Newark, is that we surveyed the city, and 60% of residents did not know they had access to victim services. That itself is an issue. So when we talk about addressing the gun violence, we talk about communication and coordination. We need, as we continue to say, is that we need the investment, right? So that communities can finally identify what the antecedent may have been, right? That led them to whatever event that got them here. Then we have the services on the back end to support that. So I think, we're starting, the president started this with the White House initiative that David Mohammed is part of. And so we're hoping that, we can go ahead and grow this. And we're hoping that the investment somehow skips government and comes straight to community.
Understood. So Lisa, I'm going to come to you on that one as well. What are your thoughts? Is there enough coordination across state lines, across communities that's occurring?
I agree with Solomon, but I also want to highlight that in New Jersey, we started the New Jersey Violence Intervention and Prevention Coalition on our own because we knew that we needed that kind of advocacy group. And remember, there's a lot of money coming into this work, right? So sometimes it is going to skip us grassroots leaders that have been doing this work for a long time for free and know what's needed. And now that there's investment coming in, there's going to be outside organizations that are also going to be kind of, trying to pull in and trying to get these kind of dollars. So yes, there needs to be coordination, and there also needs to be coordination where we highlight those grassroots organizations that have been doing this work. So this money does not, this money does to ensure that this money comes to them. I want to highlight the CBPS collective. They've actually organized a lot of different communities around the country that have been doing this work for a long time and are helping them build their infrastructure. I'm a part of one of those groups, right? Because one of the things that people don't understand that when we're trying to get these government dollars, and for example, we've been doing this work for a long time, like I said, for free. And free because we care, right? We didn't want to see our young people die anymore. But when these government dollars come to us, we're audited more often, right? It's almost like we're set up to fail. I know I've dealt with this in the last 2 years. Thank God I've had a relationship with my partners like NCST that I've been able to, go to them for advice. Because a lot of us, we want to do the work and we want to get the investment, but there's so many loophole, there's so much red tape, and so these larger organizations often get the funding, and it leaves us out of the equation, or we have to work for them and our mission might not be aligned. So yes, I do believe that coordination is important, but when I talk about that coordination, I get very worried also because sometimes these larger institutions come in and they take over the narrative. I've seen that sometimes in partnering with hospitals or universities. They want to take our data and manipulate, hey, we're going to give you some money, but we need you for data, right? And they're getting $3 million yearly grants, and we're, robbing Pete to pay Paul, right? On $500,000 grants, and they want us to stop the violence. So I just hope that, as we start talking about coordination and working together, we are at the forefront, right? Those that are right out on those blocks, talking to these young folks, that we get that investment to build our infrastructure and our sustainability. And also, a lot of people don't know this, but a lot of funding that goes into intervention work is usually to fund frontline staff, right? Not enough to build our infrastructure. So things like, management or operational stuff, or even flexible spending, right? People have immediate needs. So when we're coordinating, we can't coordinate, on the normal ways of how institutions have gotten money for years. We have to coordinate on, hey, there's an immediate need in this community. There's a beef going out for $500. We need to pay that $500 right now so we could stop some of this and work on the healing afterwards. And sometimes, when these type of larger institutions come into play to coordinate us, and that happens, they don't have they don't see the emergent needs in our flexibility. So as we continue to talk about coordination and as we continue to talk about building this network, I hope that we also keep in mind that we have to be at the center of it. Our victims and survivors have to be at the center of it. And those that have been impacted by violence and those community leaders that have been doing this work for a long time need to be at the forefront and at the center of it, not universities, hospitals, and these government agencies. So I hope that when we have these conversations, that's always kept in mind.
Yeah, I mean, and let me tell you, that was so important. You're getting applause over here, Lisa. I don't know if you can hear it, because you definitely touched on some important points. And one of the most important things that I think that you said, and I'm sure a lot of people here would agree, especially if you're in the nonprofit space and you try to get funding, that infrastructure building is an important part. So whereas it's great to get the dollars for the frontline staff and for the folks who are some of the folks who are out there doing the work, if you don't have a good infrastructure on which to build, then it either can collapse as soon as that funding is gone, or you're not able to properly invest the way that you need to support them and make sure that they're doing what's needed in a real substantive way. So I think that that's a point that we wanted to just take a moment and underscore, because especially as these dollars are coming out, and you're right, it's really wonderful that there's a lot of attention being paid. Our governor's putting some dollars behind this. You heard the acting AG speak to it earlier. The president's focusing on this. As this money is coming down, and even if, the partners who are looking to partner with organizations like yours, Lisa, and, all the folks that we have gathered here, that we are also challenging ourselves and challenging them to make sure that you're centering the folks who've been doing it and centering the folks who understand it and who are on the ground. I'm coming to you next. Yes.
And the one thing I would add to everything Liza said, which is yes and amen, is that stop tokenizing us when you want to partner with us.
Right.
Because they bring us to the table with conversations that sound as if we're going to be taken seriously for the expertise that we have and the boots on the ground and the effort and the skin, literal skin in the game.
Right.
Stop tokenizing us and be honest with yourselves. And as my pastor would say, with the Lord, about how you really wish to make change.
Right.
Because we can see that. And it really undermines the potential for true partnership. Because you cannot do this without having true partnership. And as Lisa said, people have been doing this for years for nothing.
Right.
Going into our own pockets to make sure that we take care of the community, and then to have larger entities with the infrastructure in place to come in and to pat us on the head and have us at the table. It's not enough to just have us at the table. We have to be allowed to partake in the meal as well.
That's right. You got to be that voice. And that is critically important. And look, I think this is something that we should continue to say and make as a key point, because it could get lost. It could get lost in all the other great conversations around its funding, which is great. But the voices at the table to make the real change that needs to be made, it has to be the people who've been doing the work. It has to be the people who are in the communities. Okay, you're gonna get me kicked out of here in a minute. Hold on. All right, so let me get to the next question. So I'm gonna come to you on this one, Solomon. So we've talked a lot about the financial, but let's dig into that a little bit more. And one of you brilliantly spoke to, and I'm sorry, I apologize, I can't remember who it was, but brilliantly spoke to how one situation begets another and how it continues to grow and impact these families and communities. So the economic impact of gun violence, can't be understated. It can't be disregarded. So a recent study revealed that the financial impact of firearm injuries is around $44 billion due to medical care, lost wages for gunshot victims, et cetera. Is this being discussed enough? That's a big nut. So is this being discussed enough? And if not, why do we think that is, or do we think that it is being discussed? Solomon, I'm going to come to you first on that.
Yeah, I mean, I appreciate the question. I think it is being discussed, right? But it's not being discussed with the people who are most impacted by it, right? I like to share this story. When I was 18, I got a brain somehow at 18. I found my brain, and I asked a politician in the city. I said, I lived in a neighborhood called Seth Borden Projects. They're demolishing it now. One of the oldest projects, affordable project housing in the city of Newark. And I asked him, I said, I lived in this neighborhood for 12 years. And for 12 years, I've seen people get murdered. I've seen, cops come and kill people. I've seen, folks addicted to drugs. I've seen the worst of the worst here. And why was there never an intervention? And the former politician looked at me and smiled, and he said, listen, and with an honest, remark, he said, there was too much money being made within your neighborhood to stop anything. And I know it wasn't my neighbor making the money, right? Because my neighbor was on a fixed income, right? I know it wasn't my homeboy mom making money or his dad making money because he was a dope dealer, right? The finances behind this is that who's getting the benefits of it, right? And that benefit is held within systems like law enforcement, like lobbyists, like who's benefiting from the death, as we talked about earlier around social media, like who's benefiting. And I would say lastly, like, look, as I said earlier, we're at a war, right? And typically when America goes to war, they're going to war for something, right? And they come overseas and they offer a package to those who are living there who are in these war countries, right? They go and they offer diplomacy. We have never seen diplomacy happen within our neighborhoods. We've seen a war, right? We've seen the war on drugs. We've seen, the gang war. We've seen the war on Black and brown people. This is why violence continues within our neighborhoods, because we have no diplomacy from the government that doesn't support and empower the community. And so I would just, again, urge again around investment, and to also understand that, like, listen, we're at war and we need diplomacy within these neighborhoods. As we talked about interventionists, as we talked about mediators, this is the type of diplomacy that we need with a strong investment.
Okay, thank you. Thank you so much. David, I'm gonna come to you on that same question. Is the economic impact of gun violence, is it being discussed enough? And to Solomon's point, if it's being discussed, is it being discussed in the right places?
Yeah, it's certainly not being discussed enough. It's certainly not being understood. This is a big part of what we do is try to impact this. Folks can go to costofviolence.org. But the quick note on this is when there's a shooting, you have a police response, you have fire EMT response, you have ambulance response. You often, depending upon the severity of it, have the local prosecutors respond to the scene. You have a hospitalization. You most often have an incarceration, court proceedings. You have, if there's someone is killed, you have victims. You have victim services potentially anyway, particularly when someone is killed. You have an autopsy from the coroner. Then you have an incarceration. All of these government costs, meaning taxpayer costs, add up for direct costs for on average $1 to $2 million per shooting. And that is low end direct costs that we can directly attribute to taxpayers.
Wow.
Most assessments of shootings put it a lot higher when they take into account the lost productivity of victim and suspect. When they look at over the lifespan of somebody who was involved and all of the lost revenue, tax revenue, and other areas, most people put a shooting at $5 million each. But what we have done is come into jurisdictions and say, here's the documentable direct cost to taxpayers on each individual shooting incident. And that is $1 to $2 million. And most folks will say that that is a low estimate. We've deliberately done that to say we can show the math. And when you think about $1 to $2 million per every shooting, another just quick piece here, the Philadelphia Comptroller did an interesting study showing that the home value reduction in neighborhoods that have high rates of gun violence, and that for every shooting in a 0.5 mile radius of that shooting, there is a certain percentage reduction in the home value, and then therefore a reduction in tax collected by that city. So there's real economic impacts for gun violence that we don't think about, but what we need to talk about more. But because the everyday gun violence primarily impacts Black and brown communities, you have folks who think that they're immune or not connected to it. But no, you're paying for it every day. And if you don't care about Black and brown lives, you certainly care about your pocketbook. And so we need to talk about and understand the economic impact of shootings that occur in our cities.
Those are some real dollars we're talking. I mean, this is significant impact, dollars that have not just short term, but long term impact to these neighborhoods and families. So I'm coming up on my last question for the entire panel. And I saw that we were just joined by our Gloucester County Commissioner, Jim Jefferson. So I'm putting him on notice that before I go to Q&A, I'm actually going to bring him up here for a moment. But I'm going to ask this question first to give him a little bit of time. So this question is going to be for the entire panel. So I'm going to come to each one of you. In the next segment, we're going to be talking about, so this part we're focusing a lot on the community, right? And the direct people impacted, which is important, and we wanted to do that first. In the next segment, we're going to be talking about how that translates into a public health approach and what that means. So, and to address gun violence as a public health issue. So I'm going to go through what the 4 steps are to a public health approach, right? And I'm going to want to hear from each one of you on where you think we are in these 4 steps. So step number 1 is to define the problem. Step number 2, identify risk and protective factors. 3, develop and test prevention strategies. And 4, assure widespread adoption. So I want to hear from each one of you, and I'm going to go, Lisa, I'm going to come to you first to tell us where you believe we are on gun violence. And you can speak to it nationally, you can speak to it just from your lens, locally, but which of those 4 steps, where do you think we are and why?
I think in New Jersey, we are at between 2 and 3, which is identifying the risk and protective factors, right? We continue to educate folks on trauma and poverty and systemic racism and how that impacts violence in our communities. But I think we're also at developing and testing prevention strategies. I think that in New Jersey, we're fortunate that we have these advocacy groups like NCST, our group and Jersey City Anti-Violence Coalition, working with the AG's office and the governor's office to continue to bring awareness to these kind of programs. But I do want to highlight that even though we're at these phases, we're constantly in not competition, but we're going against this kind of underlying buy-in that constantly persists, is that those get tough models, right? For example, in Patterson, as we've launched these programs in Patterson, we're using the hospital-based violence intervention, using a public health approach and doing all these things and being victim-centered. Unfortunately, the local mayor, the local politicians still believe in that get tough policing, gang task force type of, operations that consistently, kind of undermine the work that we're doing sometimes in the community and are frustrating for us because we can't test real prevention and intervention if you're just locking everybody up, right? You're just locking a whole block up or a whole community up. How do we know it's even working? So I think that as we continue to talk about the public health approach, we need to incorporate them in the conversation so that we understand if you really want to see how this works, then we need to buy into this, right? And give it an opportunity before we just sweep in and just lock up whole communities, just because it's easier or it's just more something that they believe in more. So that's where I think we are in New Jersey.
Okay, sounds good. All right, Patrick, what are your thoughts?
First, I want to say that when we think about COVID and how COVID spread, nobody said, let's get more doctors and nurses. If we have just a whole bunch of more doctors and nurses, we can stop COVID. So in the same frame, just because we have a lot more police and task force, that's not going to stop this problem. We are at number one defining the problem because it doesn't affect everybody. So they figure it's not my problem. Like the business phrase, NIMBY, not in my backyard. But we are at a crucial state. We are at one of those phases right now where this is going to get worse. It's going to spread. Just like that virus of COVID that spread, it's going to spread. And you're going to see an increase in not only your neighborhood, but people that you know. And until we come together, there's a saying I use, we can't have peace working in pieces. Too many people are operating in silos. We have our city council who is at odds with our mayor, and our mayor may have a problem with the DA. The DA may have a problem with the chief of police. We have so much dissension amongst ourselves as government, then how can we expect to bring community into unison? We see on television fighting in Congress around who's more important. We have memes put up about Donald Trump and this. And so with all this division, how can you bring people together? But it's a real problem, and it's an urgent problem. And we need to define it not only for our city, but our country as a whole. What are we going to do about it?
Very good. Thank you. Thank you. Solomon, where do you think we are in those 4 phases?
Yeah, speaking from a local perspective here in New Jersey, I think we are at, what Lisa said, 2 or 3. And that's because we've done a lot of work. And I just want to, flag that all that work was done from within, from community. It was never led by a systems-based approach, right? That work has been done from within community, meaning like similar in NCST, like we hire Pookie and Rara and Ray Ray and LaQuisha, like we hire those folks so that they can, develop to become, program managers or executive directors of the agency. That is intentional what we're doing. And I think if we want to move again to 4, where we have the widespread information and people really buying into, as we say at NCST, public safety in public hands, like we need to continue to raise folks up from within the community.
Excellent. Thank you. Tracy.
I think that depending on where you are, it vacillates from 1 to 3. I don't think that we've gotten anywhere near number 4 because of the vacillation, depending on whether it's a national scale or even if it's local. I definitely agree that the work that has been done for the most part has come from the grassroots, boots on the ground. But I also know that from the political landscape that there was a lot of buy-in to that law and order mindset, and that sells. And so until we can debunk that to really define the problem, we're going to continue in this state of vacillation between 1 to 3.
Thank you so much. Jennifer?
Yeah, I agree with you, Tracy. I think in most communities, most situations, we have a little bit of 1, 2, and 3. We are not at 4. I don't believe we're anywhere close to 4. But with that being said, thinking about it as a public health issue, COVID was a public health emergency. And look how different, right, views were, acceptance, non-acceptance, it is, it isn't, how are we going to treat it, how are we going to fix it? And so I think that continues to be true for gun violence as well. But making sure that we have awareness of the situation and what the true impact is, right? We talked about the financial cost. We talk about ACEs and how impactful those are across the board and impacting physical health over the course of time. What is the cost to public health, not just within that community, right? But within the state, within the country, nationally, what does that look like? And until we have that buy-in, from, across the board, it's really challenging to chart a path forward that is consistent.
Perfect. Thank you. David, round us out with this one.
Yeah, so in one sense, I agree that we have some version of 1, 2, and 3, nowhere close to 4. But even within that, as I said earlier, defining the problem, we've defined the problem in that gun violence is bad. But we need a lot more definition of understanding the small number of people in our community who are at the very highest risk of gun violence. There's a few jurisdictions around the country that have done that well. There's a misnomer that there's a much larger population, pretty small number of people who are at very high risk, who have these particular risk factors. We have to do a better job of understanding protective factors. What makes 2 siblings who have the same exact life circumstances, one deeply involved in violence, the other college graduate doing well. You have that, all over the place. We need to better understand what happened different, which one had a different experience with trauma, who didn't have a particular protective factor. And so we have pieces of it, but we need to do a lot better. And we have examples that we've played out, some of the effective gun violence reduction strategies, some of which we've heard today, but the widespread adoption is nowhere close, as other panelists have said. We have a number of effective strategies that have worked. You can't just plop that down in every city. Every city has its own nuance, but there are principles that we know are effective that should be in widespread adoption. On a hopeful note, there has been massive increase in investments in community-based violence intervention efforts, some of that because of some of the federal dollars, and that should give us hope to have significant improvement and reductions in violence soon.
Excellent, thank you. So that's going to wrap up my questions. And I know we have some other questions probably that are floating around out there, but before I transition there, I would love to give our Gloucester County Commissioner, Jim Jefferson, who's joined us, a moment to speak to this, because I know this is something that is important to him as well. Please, yes, because you'll be in front of the cameras over here.
Good morning. Good morning. Good morning. As Melissa said, I'm Jim Jefferson. I'm a commissioner here in Gloucester County, and I really appreciate this opportunity to come and listen. And the value of a human life. It's tough to hear just when you think about it. The ripple effects that when you lose somebody. You talk about the dollar figures associated with gun violence, but at the core of it, we're talking about human beings. We're talking about the care and concern for a loved one, for a neighbor, for a friend. And so I'm so glad that Ascenda has partnered with all of you to be here today. And as many of the panelists said, this is about the community gaining traction within the community. And it's so good to hear folks say about the most effective way to address these issues are within the community. And I'm so glad that I was able to just have that hammered home into my head. In Gloucester County, we do have very active community. We have a very active ACEs. We have active with our youth support organizations. Ascenda is a great partner. My walk is a little different because I serve on the parole board and I work with juveniles and have for 12 years. And just the very, the state of New Jersey has addressed a lot of these issues in a financial way, but sometimes the dollars don't make it into the community. And so we're, the state needs to do a better job of reaching those in need with their dollars, because sometimes dollars meet buildings, they don't meet people.
Mm.
So hopefully we can work on getting those dollars to be the most effective that they can be. And I know the Attorney General was here earlier, but laws are really hurting us too. Pennsylvania, Virginia, just the ability for folks to access weapons and then bring them here to New Jersey, where I think we do a good job of making sure that guns stay off our streets. So it's a very wide array of issues. But one thing that I deal with a lot on a day-to-day basis is trauma. A lot of our young people that I work with are victims. And a lot of people have been associated around gun violence as it's just a part of their life. It's just something they know. And when you talk about COVID and all the steps that we took to make sure COVID didn't spread, well, if somebody has been exposed to gun violence at an early age, we aren't reaching them to address what the trauma they're carrying around. So as you talk about somebody being exposed to COVID, we made sure folks were isolated. Well, somebody's been exposed to gun violence and it's really wrecked their soul, where they saw a loved one harmed by gun violence. They're carrying that weight each and every day. And I'm so thankful for programs like Ascenda and their community-based outreach and how they're looking to reach people. But at the end of the day, we have to reach people. We have to fix those wounds that we might not see. And so I'm so glad that to hear from all these speakers, to be here today. I'm sorry I'm late. I had my mom fell and broke her arm. She just, God bless her, she's 68, she shattered her elbow, but she's on the road to recovery. So as we all are. And I just think, I know I mentioned 2 jobs, but I'm also a prison minister by trade. And there's a passage in John chapter 8 where Jesus is confronted with somebody and they bring this woman before Jesus and they say the penalty for what she did is she should be stoned to death. And Jesus says, okay, that's what the law says, but you without sin cast the first stone. And I think that approach of like, we're all not perfect and we all have skin in the game. And just because what I do doesn't look like what you do, doesn't mean that we're all not of the same value. And I think that more people need to take the approach that, while we're, suffering from this issue of gun violence, we need to make sure people know that their lives matter in what we say and what we do. So I'm so thankful that you're all here. I'm thankful for Melissa putting this together. She's really a dynamo. Ascenda couldn't have a better spokesperson today. So I'm thankful for all of you being here, and get this mic away from me before I talk.
You'll get me in trouble. Okay, thank you so much, Commissioner Jefferson. So now we're going to transition to the Q&A, and Rachel's going to take the lead on that and let us know if we have any questions for our panelists. I see Carrie's giving me the signal back there. So do we have anything, Rachel?
Mrs. Fox, for your first question, from a young mother, she's wondering, what can she do? What can she look out for? Any warning signs to help her be able to ascertain how to be that first beacon of light to interfere with any possible outside forces that could cause her child to maybe go in the wrong direction when it comes to gun violence?
So I don't know if anybody wants to jump in on that question. Go ahead, Patrick.
So in 2018, the #1 song in the country was by Drake. It was called In My Feelings. And what we find is that a lot of these problems are attributed to people in their feelings. So for the mother, I would want her to observe her child and how he reacts when he gets in his feelings. Like temper tantrums, or is it a lot of kicking? Like what behavior is emulated when this person really gets in their feelings behind something? We all have a button that if somebody touched that button, it's go time.
Right.
But what if you live constantly on go time mode? And so I think it's good to just do the social emotional learning of how that person responds when angered, right? Do they throw things? Do they get violent? And we need to address that earlier. And so it's a good way to identify how that person will respond violently if they're always in their feelings.
Wow, that's very good. Does anybody else want to speak to that? Jennifer, I didn't know if you had anything to that as well.
Yeah, I mean, what I would say, right, from a parent is to allow the opportunity for communication. It doesn't have to be big. It doesn't have to be bold. It doesn't have to be about big feelings either all the time. Just the fact that you're there to listen and be ready to listen to whatever might be said and have that open door, two-way communication. There's a lot that can come from that, a lot of trust that can be built and safety that can be maintained.
Okay, excellent, thank you. Do we have another question?
Yes, our next question, historically addressed from a law enforcement approach, new policies rooted in public health lens are necessary. Thoughts on how policy can help going forward?
Does anybody want to respond to that one? And I'm sorry, can you read that one just one more time, Rach?
Yes. The writer asks, historically addressed from a law enforcement approach, new policies rooted in a public health lens are necessary. Thoughts on how policy can help going forward?
So is that the law enforcement policy and the public health approach? Okay, so I don't know who wants to jump in on that one. David, I saw you nodding. Is that something that you wanted to speak to?
So assuming I understand the question correctly, so there is, we do have to address the role of law enforcement, how a law enforcement can effectively be a part of reducing violence in a way that is fair and that is not causing further harm. There was discussion, earlier in the panel around some of the challenges of policing that we've seen play out significantly over the past few years. And I actually think that there is significant win-win here when done right. So just a quick breakdown. When we think of policing, most of policing we think about is patrol, and most police departments, 50% of the department is the patrol division, and all of the patrol division, what it does is respond to calls for service, mostly 911 calls. And a lot of those 911 calls are for extremely low-level issues, many of them not even criminal acts, noise complaint, abandoned car, neighbor disputes. And if we can have alternative responses to that, these are calls that police often will tell you, I've interviewed several police about this, that they're not interested. They didn't sign up to go to these, kitten in the tree calls. And these are the low-level calls that often escalate to these horrible situations. Jaywalking in California, where a person was killed by police. A person didn't have a light on his bicycle in Vallejo, California, ended up being killed. A $50 counterfeit bill, supposedly, in Minneapolis, right? And so if we say we can have alternative responses, and have police focus on more serious crime and violence, have better training, be better equipped, have more intelligence-led policing, we really can have a win-win. We can have a smaller footprint of law enforcement on the community, focused on what people are most wanting enforcement to focus on, serious crime and violence, have alternative responses to other needs of the community. We really could have this win-win where we improve policing, focus it more, and have greater investment in other community responses.
Okay, thank you, David. What other ones do we have, Rich?
Your next question. There's a lot going on in schools with kids having guns. Have you seen good examples of schools or teachers getting involved with creating solutions?
Yeah, and so in Minnesota, there's a peace ambassador, was a gun-free zone, and there's a peace ambassador program. Actually, we're trying to launch it in New Orleans as well, where you make the students peace ambassadors throughout the school, and hopefully stuff that happens in their peer-to-peer programming, that hopefully they de-escalate situations that happen in school and stop it from spreading into the community. It's really worked really well in Minnesota, and it's something that we're trying to bring to New Orleans, because a lot of that stuff, it escalates in school, it's put online, and then now you have to defend it in this at home. New Orleans is unique because we're the only all-charter school system. I don't know if people knew that. So you have kids who are bussed off from different neighborhoods and different areas, and now you're in this school. And so your area gets this area, now you're in the same school. And a lot of stuff, that conflict is gonna come. And so if we have people in the school peer-to-peer that can de-escalate it, then we can stop the spread from when they go back to their community.
Wow. I'd be really interested. Do you know what that program's called? I would love to look into that.
It's called, you can just Google Peace Ambassador Program, Minnesota, gun-free zone.
Okay. Thank you. Because I'm really curious about that, to see how that works and how the kids get involved and how they get trained and how they get supported.
It's similar to the model that we use for barbers and beauticians, but they learn conflict de-escalation management, and they're not police patrolling, but they just have a space where they could talk about and intervene and mediate conflict.
And I love that, because not only is it giving them skills to use to help themselves and that, and their peers, but it also gives them great skills to use for themselves personally. as they grow. So thank you for that. Oh, yes, please.
So conflict resolution, right? You touched on that and the ability to de-escalate. There's a lot of school programs in New Jersey that are working on this and working on it younger and younger, I will say. The other piece in New Jersey, I have to say, has done a really great job with this, but we have something that's called the Traumatic Loss Coalition. So every county in the state of New Jersey has access to the TLC. I actually have the ability to kind of go out on some recent situations that have happened in the county of Salem. Whenever there's a loss, there's an opportunity to provide postvention, provide supports, provide resources, provide education, connect to resources in the community when there is a traumatic loss. But there's also the opportunity to do prevention work. And it's not just suicide prevention, but it's trauma prevention. And so every county in the state has access to those resources. Every school system within these counties has access to those resources, which is a really great opportunity.
Thank you. Rachel, do you have another one?
Yes. Next question. In your opinion, does the media make the perception of gun violence as a public health issue better or worse?
Who wants that one?
I'll quickly say the media is horrible as it relates to violence on so many ways. I won't even go into it to talk for an hour. The short version is the media is horrible around its coverage of violence.
And is that specifically related to it being seen as a public health issue, David? Or are you just saying in general?
Yeah, and I thought, I don't know if it was Solomon or somebody else was trying to get, so I was trying to just be very brief, but I would say in general and you know, it doesn't have understanding. There needs to be a lot of awareness raising and educating of journalists to understand what even the violence as public health issue means, and certainly how it's covered.
Okay.
I'd only like to add that when we look at the news on a daily basis, I'm really always frustrated because when Johnny commits a crime, they immediately outline how he's misunderstood and how he's had mental health issues, and there have been things in the past that have gotten him to this point. However, when Raheem commits a crime, it's immediately the villainization. And it happens over and over and over again. And we see it play out repeatedly. We see it play out with the Dylan Ruths of the world. Yeah. And we have got to have journalists and media folks to understand that they play the biggest role, one of the biggest roles in perpetuating the fact that there is a lack of valuation on Black and Brown lives based on the narratives that they continue to perpetuate in the media.
Perfect. Thank you. Thank you very much. Rachel, do you have another one?
Yes. Next question. Since suicides are a big part of gun-related incidents, are there warning signs or signals I should be looking for in my child to know if they are at risk?
Jennifer, you want to take that one?
Yes, there's always warning signs, but sometimes they're not as clear as you think that they might be. You know, I mentioned earlier kind of the opportunity for communication with your child and or trusted adult or friend, whoever that might be, and giving them the tools and the opportunity to, you know, get help and get assistance should something be going on. But I would always say any change in behavior that is different, that is not characteristic, that is not typical of your child or someone that you're close to, pay attention to that because there's usually something else that's going on. They could be impacted by a situation with a friend. There could be that social media thing that's going on. There could be a relationship that they're struggling with, but looking for that difference and that change. If it is different, if it is changing, pay attention.
Perfect. Thank you. And if they see something, say something. I mean, let's go to whomever.
There are resources throughout the country. Ultimately, I don't know where this question has come from, but there's also some change in legislation that's coming out soon too, with some help numbers, that 988 number that's going to be coming out shortly. So yes, there are resources.
Go ahead, Patrick.
And just also, first, if there are guns in the home, lock it, store it properly, because those suicides are primarily committed by acts of violence using guns, and they're found in the home. And also, are we paying enough attention to what has their attention? So are we looking at the social media? Are we looking at the friends? Are we listening to the music? Don't just give them a phone and headset and just say, oh, I'm gonna let that babysit my child while I'm doing whatever. No, you should know what they're watching, who their friends are, who they're following. Just be actively engaged in their world. Not spending all the time on Roblox or Fortnite, and where you can be, destructive. And that has to go somewhere. Are they being commented and not liked on social media? Are they changing their style to fit in? Do they feel like they're not attractive or not pretty or not enough? Are they dealing with gender concerns about what about my sexuality? You should be that involved and know what's going on. So when something does happen, like the doctor said, you can see the change and be active in trying to intervene before something turns fatal.
Thank you. Thank you
One
for that.
additional piece
Please.
for parents. There's no handbook for parenting.
Right.
And any and every time something happens with our children, we automatically internalize, what could I have done differently? What did I miss? And so to browbeat yourself is just really futile. And it defeats your ability to really be engaged in the action of parenting, because it's ongoing and it's nonstop.
Right.
And so be gracious to yourself. Identify the areas where you are weak and seek help and assistance when you need it to help you get what you need so that you can be the parent that your child needs. There's no shame in making a mistake in parenting.
Right.
The shame is just hiding and not seeking it out.
Very good. Thank you. Thank you. Oh, okay. 5 minutes. All right. Do we have one more?
Yes, we do. You mentioned the economic impact of gun violence. Are there any discussions about how to reinvest in the communities which may be affected the most?
David, I see you nodding to that one.
Yeah, no, absolutely. This is a huge piece, right? So if we think about the massive amounts of money it takes the criminal justice system, we already talked about the cost of gun violence. We need to uplift the understanding of these costs for adults in the system. It's anywhere between 50 to 100,000. California, the annual cost of an adult in prison is more than $100,000 a year. That's according to the state system itself. For young people in the system, it's astronomical, $200,000 a year to have a young person in the juvenile justice system. If we better used those funds to invest in the community, to invest in neighborhoods hardest hit. Just quickly, when I worked in DC in the juvenile justice system, we were looking at a neighborhood that had, in a 5-block square radius, that had 20 young people committed to the juvenile justice agency, which meant about $3 million a year being spent every single year on this 5-block radius, but never on that to pluck those children out of the neighborhood, supposedly go cure them somewhere in isolation for a year, and then put them back into their uninvested community. And that was just one agency, let alone the adult system, the child welfare system. Like, if you take all of this government investment that is ineffective on the individuals, if we put that in these neighborhoods, in these families, we could see significant return of our investment, not doing harm, but really developing these neighborhoods and these families.
Excellent. Thank you so much. So please join me, everyone here, in thanking the panel. Thank you so much. I want to thank all of you, your time. You've been so gracious with your time. You've been gracious with your expertise and your brilliance. Your information will be posted if it's available for people to ask questions, because I'm hoping that this is not the final conversation, that this is only the beginning. I want to let all of the attendees, virtual and in person, know that this recording will be available on site, and you will receive information about that. Just make sure to check the Ascenda Institute of Health Innovation site, which is ascendainstitute.org. I will also say that for those who are here in person, you will be treated to lunch. So lunch will be available for the break. So because this ends our first portion of the summit, and we'll be coming back, I believe, at 12:10 to begin part 2, which is when we will be taking this information and begin applying it to public health strategies. What does that look like as we begin to move forward? Over the break, we will also ask that you stay with us if you're virtual or even if you're here in person to watch the Ascenda Institute of Health Innovation Momentum Awards, which we just recently showed and had some wonderful people that we recognize for their work in moving our sector forward. So please stick around for the next 30 minutes or so. Join us for part 2, either virtual or in person. And please let's join me in thanking again our amazing first panel for your input. So thank you, everyone. It's just my confirmation monitor. So everybody up there can see the big screen. Am I on? Testing, testing.
Good afternoon. On behalf of Ascenda Integrated Health and Ascenda Institute of Health Innovations, I'm happy to welcome you to part 2 of our summit, Merging Science and Safety, Addressing Gun Violence as a Public Health Issue. We caution attendees that today's summit may contain discussions which may be upsetting. If you find that you need additional support, please visit www.ascendahealth.org. On-site attendees can receive support as needed from Ascenda team members. I am Rachel Green, Director of Diversity, Equity, and Inclusion, and Operations Coordinator at Ascenda Integrated Health. I'm here along with my fellow Ascenda team members to help make this a valuable day of learning and sharing. During today's event, all virtual attendees will be in listen-only mode, and in-person attendees are asked to hold all questions and remarks for the Q&A segment. For all attendees, both in-person and virtual, the information on your screen currently includes a link which can be used to submit your questions for the panelists. I would like to extend a special thank you to our event partners, Gloucester County NAACP and Rowan College of South Jersey. Their contributions to this event have made it possible. Thank you. I would now like to reintroduce Mrs. Melissa Fox, Ascenda's Chief Operating Officer, to moderate our second panel of the day. Again, welcome to all of you, and thank you for attending today's summit.
Thank you so much, Rachel. So for those of you who are rejoining us from the first panel, I'm sure we can all agree that it was an amazing discussion, thought-provoking, honest, transparent, and powerful conversation about the impact to the community. What are we seeing at the community level as it relates to gun violence? And some of it we know, we recognize on some level, but to be able to dig into it from a different perspective. I mean, we were talking about, the not having, if we're talking PTSD, there is no post when you're talking about the trauma associated with gun violence and how it impacts the community. So for this part of the summit, we now have assembled some of the best minds to talk about what does it mean then to take all of that community level impact and translate it to a public health approach. What's required, what's important, who needs to be at the table, et cetera. So I'm so excited to talk to this group of people. And once you hear what they have to say, you're going to be really, really excited as well. And so as we get into this, I just want to remind everyone that you are able to submit your questions. You will be able to see that information for those virtual and in person. We look forward to getting your input because we do want this to be a give and take. So I'm going to transition to the panel right now. I'm so excited. Now, all of your bios are posted online. And so all of you listening and watching will be able to access their information. But I'm going to ask each one of the panelists to, right as you're answering your first question, to just remind everyone your name and your role. So that's all I need you to do, and then go ahead and answer your question just for the first time. So we're going to jump right into this and really just get to the heart of it. What does it mean to have a public health approach to violence? What's a gun violence? What does that mean? And why has it not been widely addressed as such? So we're going to start out with Eric on that question.
Sorry. Good afternoon, everybody. My name is Eric Johnson, and I am a national coordinator for strategic partnerships with Cure Violence Global. I'm glad to be here. Thank you guys for having me. And you ask about public health approach.
Yeah, what does it mean to have
What
that
does it
approach?
mean, right?
Mhm.
So when you talk about a public health approach to reducing gun violence, it's just that, like, it's it's everybody involved, right? I think a lot of times when we talk about violence, we've traditionally looked at things from a morally standpoint, right? Like good people, bad people making bad choices, things like that, and public health approach allows us to look at things from a scientific, method, meaning like if we know how to stop epidemics, if we know how to stop coronavirus, if we know how to stop cholera, the measles, the mumps, and if violence then is a public health, issue, which it is, right? Then we can approach those violence in the same manner as we approach those other diseases and get results. So when we talk about, approaching violence from a public health standpoint, that's what we talk about. We talk about, interrupting the transmission, stopping the spread, the future spread, changing behavior norms, things like that. And when you talk about why hasn't it been adopted, I think again it speaks to people just. I think it's a multifaceted answer to that. I think now it hasn't really affected. Now it's starting to affect more people, right? I think historically it's only affected a certain community and hasn't really, this approach hasn't really done that, right? And so now it's starting to spread, which diseases do. And so now we're trying to, do something different. So I think that's why I hadn't necessarily been adopted that matter. I heard my colleague right here speaking up. So if you wanted to kind of chime in, go ahead, brother. Yeah.
No, I was just agreeing with you.
Yeah.
Absolutely. It comes from, like you said, definitely the data and public health, it being encompassing everything. So I definitely agree with you on that. And it is like a disease, and we have to figure out the way how to stop that spread. So I agree exactly what you mean.
Thank you so much. And Sean, what do you think?
So I'm Nation Hornsby, Assistant Commissioner of New Jersey's Department of Health. The division that I oversee is Community Health Services. And so I address all areas of concern related to chronic disease and illness. And violence is chronic. It isn't something typically that is just episodic, but it revisits communities and in particular, some families, some individuals over and over again. But let me get to the question posed also. In public health, we focus on epidemiology. And in simple terms, epidemiology is the study of the root cause. Where is it coming from? And people have this misconception that public health is about health officials doing stuff, about nurses, doctors, and nowadays focusing on community health workers and them doing stuff. But at its heart, public health is not about just a small group of individuals. It's about a holistic view, about policies that don't fall in squarely into health space, about policies that will address the root causes as to why conditions exist. And so, for instance, the points earlier made by Eric about where we saw cholera, we saw measles, we saw outbreaks. It's to try to find out why. Where is it coming from? And tackling it no matter what it is. So if the cholera is coming about because the water is contaminated, then you deal with the water. That's not a health thing. It's not in a hospital. It's not a doctor that's going to do that. It's not a nurse that's going to do that. But it's affecting policy that will ensure that we are turning and bending the curve on some of these surges that we're seeing. And in particular, the scary surges that we're seeing in violence and in firearm usage in connection with violence should cause all of us, not just health officials, it should cause all of society to be concerned about it.
That's powerful. So understanding that, what do you think has been the barrier to keep people, in your view, because you have a very different perspective, what do you think has kept the larger public from understanding this, or even systems to adopting the public health approach where you live every day?
So I think Eric also pointed out that it's a them and not an us.
Mhm.
Unfortunately, violence is one of those things that carries with it some of the other systemic concerns that we see in public health. Racism, to be quite blunt. There's also classism. There is a sense that it is isolated to certain segments of society, and belief that those segments of society bring it on to themselves. That's all that they do. That's all that they know. But I want to challenge us to think in a different way. If we think about why segments of society see more violence than others, we can tackle it. But even at a more base level, one of the things that we're coming to understand is that violence takes place all over this country, in all types of communities. It's just that it's reported differently. And so some of the self-inflicted violence, for instance, suicide rates are out of control. And much of it with young people using firearms to take their own lives. And this is not about, let's not become political and talk about Second Amendment rights and taking away guns. But I think we can all agree that young children should not be able to have access to firearms. That affects no adult's Second Amendment rights. But yet we see year after year after year, tens of thousands of young people taking their lives because firearms are available to them. Within communities that are urban, and we see some of this youth on youth violence, firearms being in the hands, being available to them for this to happen is a big part of it. And so again, I'm not one of these public officials that is going to say that the solution is that we ban guns altogether. That's never going to happen. But making sensible policy decisions that will ensure that it isn't so easy for young people to access these firearms in the first place, and then also ensuring that we're addressing, again, the root causes. Why is it okay that certain communities have such high levels of poverty, that folks are pushed to the edges of society, and that they are dealing with housing insecurity, food insecurity, educational deficiencies? All of these are contributors to violence. It isn't just a single thing. And it isn't just because people like violence and people want to be at the end of a gun. That's just not it.
Thank you very much. Christopher, I'd like to get your feedback on that question. What do you think it means to have a public health approach to gun violence, and why do you think it hasn't happened more widely?
I think, well, thank you. So I'm Chris Patterson, Assistant Secretary of the Illinois Department of Human Services, Office of Firearm Violence Prevention in the state of Illinois. One of the ways I think about this often is that, if you think back, I've been in violence reduction space for more than 12 years now. And one of the things that we were not talking about 12 years ago, 5 years ago, if you would, overall was trauma, mental health support, and how that related to violence. And many of us who have been in the field remember when, at our best guess, trying to just make sure young people had, their time was occupied and or had a job to go to. Now we've evolved into our thinking. So it's a growing field is what I would like to say. It's a young field in respect to the importance of public safety. I'm so glad that, as we talk about how to make public health a popular word at the dinner table, if you would, you can't do it without mentioning the structural racism that exists. For years, and I'm in Chicago, and for years I have a mother who was addicted to heroin. There has always been a heroin epidemic, if you would. But again, those epidemics existed within a community called Black and Brown, and weren't mainstream problems until they were. And it became an epidemic. And I think what now we've been able to raise attention that firearm violence or gun violence If it's not made a public health epidemic, then we see our cities overrun by, people who have been impacted by firearm violence, trauma, and poverty. And so it's better to, and I think now the idea is it's probably better to invest in folks before, that rage, that anger, that unsupport shows its ugly head. So, I'm glad that, it's taken a while for, all of us to get on the same page as it relates to trauma, public health, but I'm glad we're here.
Absolutely. And I'm hearing some of the similar themes from this morning's panel to this one, just in terms of some of the causes, some of the ways that this is manifesting itself. So there's a there, and it's probably obvious to all of us here in this room that if there's so many similarities, if there's so much clarity around, excuse me, what the causes may be, then the logical next approach is to be able to implement strategies that affect those causes. And so that's where we get into some of these systemic barriers and that we've heard consistently throughout. So I appreciate all of your input on that. And that's a good segue into my next question. And Daniel, I'm going to come to you for this one. What does the research tell us that supports a public health approach to gun violence? What are you seeing in terms of the data that's already there? What's the research saying?
Sure. So hi, everyone. My name is Dan Semenza, and I'm a criminologist and assistant professor at Rutgers University. I'm down at the Camden campus. So thank you all for having me. In terms of the research around, a public health approach to thinking about gun violence, I think one thing that all of the panelists just kind of scratched the surface of was sort of this idea about prevention versus reaction, right? And that a public health approach to gun violence is increasingly seen as something that should be prevented, stopping a shooting before it happens, whether that's through something like street outreach and utilizing interrupters that can actually engage with community members, or hospital-based programs that have been shown to be effective in certain areas. And so really what we're talking about, I think, from a public health perspective is how do you prevent something from happening? And prevention, rather than reaction using laws and police, is a lot less expensive, right? So I think when I'm trying to appeal to the minds of people who are thinking dollars and cents and how do you create interventions to save lives, it's really understanding that there are tremendous medical costs that come to communities, especially disadvantaged communities of color, that come from, reacting to shootings and reacting to gun violence rather than preventing it. And there can be a lot more investment for less money if you're thinking from a public health approach and from a preventative approach. I think the good news is that, like a lot of others have said, we are starting to get a good understanding what the causes of gun violence are, right? At the community level, some of the macro structural things like concentrated poverty, racial segregation, institutional racism embedded in police departments and reactive approaches to gun violence. So we know that these are the big things that kind of cause gun violence to cluster in certain areas. And we also know that gun violence tends to cluster among just a very small group of people within a given neighborhood, right? And so there's sometimes perception that like everybody in a neighborhood where gun violence is high is carrying a gun and is shooting and is ready and willing to shoot at any moment. And like another panelist said, no, most people do not want to be involved in guns. They're carrying guns because they are afraid of being victimized. They're carrying for self-defense. And because of the research that has been showing over and over again that this tends to cluster amongst a relatively small group of people, if you can identify who those most at-need people are, you can then create interventions to say, hey, we can offer support services. We can get you out of a situation. We can diffuse, a beef or a impending argument or fight between people that could end up in violence. So again, it's investing in those people, investing in that relatively small group to stop shootings before they happen. And I think that there's a lot of support to show that this can be much more effective, more cost effective, but also work quicker than saying, hey, we are going to address the deep root causes, which can take a lot of effort, a lot of money, a lot of buy-in from political leaders and things like that. And so being able to focus on those smaller groups with some of the research that we know can be a very effective approach towards this.
And you just touched on something, thank you very much. You just touched on a couple of important points that are underscoring some other important points that were made. And I think Patrick Young in the first session mentioned a couple of very strategic approaches that were very targeted, to your point. You know, it's not everybody. So if it's a certain group or a specific, subsection, then what are the strategies we can put in place to support those folks better? So I think that's something you're touching on that affects the other important point, which is the cost. We'd also talked about that at the first session. I think the number that was mentioned was $1 to $2 million per incident in terms of total cost. So, and that's just kind of all in. And so that's significant. And we're talking about what you just touched on, Daniel, just in terms of, how to better reinvest those dollars in the cost. I mean, it makes sense. It makes dollars and cents when you think about it. So thank you very much for that. So we touched on some of the complexities to this issue and the disparities. We've touched on that a bit, that are impacted by other social factors. So I'm going to come to you again with this one first, Eric. Does a public health approach to this issue require a local, regional, or national strategy to be most effective, or is there some combination?
Yeah. Can y'all hear me? Okay.
Yes.
I think it's all of that. I think it's not one, because when we look at like the administration, this particular administration from a national level, this is the first time that, we've seen this amount of funding be available for this type of approach to gun violence. And so it's not just community, even in the hospital too. So I think just from my experience, I worked at Grady Hospital down in Atlanta. I started a program down there. I started a community program down in Atlanta as well. And now being on a global team, you need it at every level. You have to have the support at every level, because if you don't have it at every level, then you're going to falter. I think most importantly, obviously you need the funding coming from a national level, because obviously a lot of times there's more available nationally than there may be locally. But the problem that comes in play with that is a lot of times the requirements needed to meet the fiscal responsibilities from a national level, the local people who are going to implement, that program, they don't have the means to report back because they've never received any type of funding from that national level. So I think it takes support from every level, but yeah.
Right. So it's all, but and you just underscored an important point, which was brought up early in the earlier session. Lisa said that, even when that funding becomes available, to your point, the local organizations who get it, it doesn't always cover infrastructure. So that's a key part of it. It may be front, and I know, Nation, you hear this as well. It doesn't necessarily cover the infrastructure, or if they're partnering with the larger institutions or larger organizations, they may not get the focus or the supports, or may not be centered based on their experience the way that they should be in the intervention. So it doesn't do, even though the funding's there, it doesn't always get to where it needs to go. And I think that was part of what you were just saying. So Retha, I want to hear from you on this one.
So good afternoon, Melissa. Good afternoon, everyone. It's great to be here today. My name is Retha Onitiri, and I am the Program Director and Restorative Justice Coordinator at Salvation and Social Justice, located in Trenton. Absolutely, a public health approach requires a strategy at all levels, but it starts at the local level. So I am an organizer at heart, and I believe you just cannot do anything without organizing at the local level. Salvation and social justice theory of change involves extensive community engagement and advocacy, and it also involves making sure that you build relationships and engage folks who are most impacted by gun violence. We have found that in order to move public health policies and in order to move funding away from law enforcement and into community-based solutions, you have to be organized at the local level. You have to build coalitions, you have to build relationships, you have to fight for the funds that you need at the community level, and you have to be engaged not just at the local level, but also you need to make sure that you are connected to what's going on at the state level. So at Salvation and Social Justice, we are actively engaged with the New Jersey Violence Intervention and Prevention Coalition led by Will Simpson of Equal Justice. We're also honored to have the opportunity to strategize with great minds like, Solomon Middleton Williams with the Newark Community Street Team. I believe he was on your panel this morning. Also with Dr. Lisa Chowdhury and the Patterson Healing Collective and Pam Johnson at the Jersey City Anti-Violence Coalition. I mean, we need all of these folks in the room fighting for public health strategies and for funding. And it's a lot of effort, it's a lot of time, but you can't move it without it. And then finally, we also are actively engaged in webinars and trainings offered by national organizations like the Community-Based Public Safety Coalition. We try to stay connected to new strategies and funding opportunities coming out of the White House Community Violence Intervention Collaborative. And so at every level, folks at the local level has to be involved at every level of strategy building, solution development, fighting for funds in order to make sure that the public health infrastructure for folks in the community are what they need it to be. Thank you.
Perfect, thank you. And all of that working together, all of those pieces working together definitely sound like that's key. Malcolm, is that your experience as well?
Yeah, I definitely agree. Again, hello everyone. My name is Malcolm Yates. I am the Director of Government Affairs for Public Health Management Corporation, enterprise-wide, and we are the Public Health Institute for Pennsylvania and New Jersey and for Delaware as well. And when you start thinking about public health, it does really encompasses everything. Like if you heard my colleagues, they say it encompasses it all. And I feel that we rely on one level of community leaders, that we can't do that. We can't rely on one level of community leaders, elected officials, or activists to handle it, because there's not one magic bullet for this. To really get a handle on it, we need an all hands on deck approach. Whereas a collective, we gather some impactful leaders, some organizers, and to create a plan that addresses this disparities surrounding the underserved communities. I mean, a complete wraparound strategy, which will cover things from A to Z, from asthma to zoning. I mean, building zones is another component when you start thinking about our communities and what buildings are there, what stores are there available, and how they have a propensity to create a violent atmosphere. So we need to understand that a global approach is the only way, because there's so many factors that play a part to this. And we should have everyone in each team commit themselves at 110%. And I feel if we do that and commit to their specialty, that we can get a real handle on this gun violence epidemic.
Now, you said something interesting that I've never thought of before, and perhaps I should have. You're smiling because I'm thinking the same thing: buildings, and how that impacts community violence. And I know I'm kind of going a little bit rogue here, but I would love to, and one or both of you, to talk about that a little bit more. How buildings and that environment, that kind of brick and mortar environment, is contributing to or can affect gun violence.
Absolutely. I mean, when you start thinking about our neighborhoods, you have the certain stop and goes, or you have certain neighborhood stores that pretty much cause in certain types of crowds. And how they zone certain neighborhoods where maybe it's an old industrial neighborhood, and then that industry had moved out, so now you have abandoned buildings where now neighborhood children gets the chance to sit and linger. So it really has a really big impact on our neighborhoods and where you'll find some of the most violent activities.
Interesting. Naisha, do you want to add to that? So you look like you want to give some input.
You're on it, Malcolm. So I'm thinking about number one, I'm a lifelong resident of New Jersey, born in Neptune Township, and have lived in various sections of geographic areas of the state throughout my time here. So Monmouth County growing up, Essex County for law school, down in Mercer County now where I reside. And I've seen the landscape, and I have family in Camden. So I've seen all of these different landscapes, and what you'll notice about New Jersey that it doesn't take long for you to notice. You go into certain communities, and as Malcolm is saying, there are abandoned buildings, blighted buildings. The number of liquor stores per capita is an indicator. The number or lack thereof of supermarkets per capita is an indicator. It's a food desert. Conversely, the number of fast food store chains versus healthy options in certain communities is an indicator. And then you look at some other infrastructure pieces, parks that are safe, up-to-date schools, structures where our kids are taught, the basketball courts of those schools, whether they have actually been maintained, just basic things, water fountains, whether the water fountains, I know it hasn't escaped from us when we were hearing about lead in the water and how certain school districts had to shut down because the pipes were so old and antiquated that if you ran the water, you would see it was rusty or whatever. Just from visual observation, you could see the difference in quality. All of these things matter. And in some communities where those old factories would have been converted and they're lovely lofts now, they're, $1 million lofts, looking in the next door community. And it is a den for, people who are homeless, a den for gangs and other things that we would not want to see. So we've got to be looking at these infrastructure pieces. They're critical.
Yeah. Thank you both so much. And so, Nation, I'm going to actually come back to you for this next question. So what do you believe the role of state government is in an effective and sustained public health approach to gun violence?
It is holistic. And so it is not reliant on one agency. It is interagency within government. And so in my seat where I sit as assistant commissioner, I'm constantly communicating with my partners in Department of Labor because we need to, as an earlier speaker talked about, youth employment, that's critical. Pathways for young people, so we need to talk with education. We need to have them at the table. We need to be talking with those who handle youth who have behavioral health needs. So we need to be talking with our colleagues in New Jersey, Children and Families. They have the system of care for our young people, CSOC that we call it, Children's System of Care, which is Youth Behavioral Health Services. We need to be talking with folks within Department of Environmental Protection, ensuring that the environments within which our young people grow are healthy and are conducive to their development. We need to be speaking with individuals within law enforcement. And on that point, I think some of the discussion isn't about defunding law enforcement. It's about rethinking law enforcement and rethinking the concept of public safety. It's not just about enforcing laws. It's about supporting communities. And then finally, I think another player at the table within government structure should be our individuals within the Department of Human Services, where a lot of the resources for families that are vulnerable lie. And then outside of government, government needs to, and we do, work with our partners in the community because they are the ones, the boots on the ground that know the community. We don't know it. As much as we may have some lived experience, I do, as a young person who grew up poor in New Jersey, but I am a government official and have been for 20 years. And so people at the ground level in those communities that know what the current concerns are have to be at the table. That includes the individuals within the faith community, that includes individuals who are organizers like Aretha, that includes individuals within grantee agencies that we fund. They all need to be at the table.
Very good, thank you. Christopher, I'm going to come to you for that question as well. What do you believe the role of state government is in moving this towards a public health issue?
We had the privilege of having our governor, J.B. Pritzker, announce and sign an executive order declaring gun violence and firearm violence a public health epidemic. And I think, having our legislators, elected officials step out front, be bold enough to say what the community has been saying for so long is one of those helping hands. And I think in Chicago and Illinois, we have a very tight infrastructure as it relates to government taking that seat, if you would, coordinating with one another and making sure that we're actually not doing more harm in our funding opportunities. And so with that being said, in the city of Chicago, the Cook County, and the state of Illinois, want to make sure we're coordinating efforts to make sure where we're doing funding, how that funding is showing up, who's being funded, right? Because we also have a responsibility to make sure that we're not setting our providers up for failure, if you would, right? And so I think a large part, it's about coordination.
Mm-hmm.
It's about taking a lead and getting all sets of government to go down the same path that actually serve people in the communities we live in, serve.
Okay, perfect. Thank you so much. So we're talking about, and you've all kind of touched on this a little bit in terms of the coordination and stakeholders, et cetera. But I really want to hear you talk about a little bit more, Malcolm, because I know where you sit is a unique one in terms of experience and visibility to this. But who needs to be at the table for these types of conversations to work, these discussions to work, and why do they need to be there?
Excuse me. Who's need to be at the table? Everyone. I mean, this table should not have assigned seats. It shouldn't have capacity limits.
Mm-hmm.
It shouldn't even be COVID restricted or 6 feet apart. It really, everyone needs to be at this table. I mean, we need to have family. We need to have the voices of the survivors, families who lost loved ones. I'll briefly share my story as a gun violence survivor myself. At the age of 6 years old, I was caught in a crossfire between two rivals. I was in a candy store in 1988 with my 2 brothers and 6 cousins and some neighborhood children. When an argument came out, started to break out, and then that argument changed into gunfire. One gentleman left out the store, came back, stood at the actual doorway of the store, and exchanged gunfire with the person who owned the store with 13 children inside the candy store. The older children, my cousins, they playing video games, they hid and took cover behind the video arcade, back in the day, the Contra, the Pac-Man. But myself and my cousin and my brother, being the younger ones, who not really prepared to respond to gunfire, we weren't the lucky ones. My cousin was unfortunately shot in the foot. Myself was shot twice, once in the left hip and once in the right foot. And then my youngest brother, unfortunately, took one to the temple where he passed. I'm 6, he's 5, my other cousin is 9. The oldest person in that candy store is 13 years old. So seeing that and actually living through life, going through rehabilitation, counseling, trying to learn how to walk, going back to school, this unique aspect is something that, is needed. You need to hear that perspective from the gun violent victim, and also even to say the gun violent the perpetrators, the shooters, they need to be at the table, because we need to understand what made them or what led them to these actions, or what resources are not there. What is it that caused that type of situation? So, we need to figure out what's missing to bridge the gap between those shooters and our community, our government, our local activists, and figure out how to prevent the other children from following suit. Because, without certain gun violence prevention, myself, my brothers, my older brothers or cousins, we could have become one of the shooters. We could have been using that anger, that rage, or that frustration, and became a victim of our environment and started to hurt people. So we really need to start to look at that and have everyone at this table, so that, again, have a global approach.
First of all, thank you so much for sharing that. I mean, that's your experience. It's heartbreaking, it's powerful, and I think it's a message to everyone who's involved in this work. I mean, to remind us that these are not just numbers on a page. You know, it's not just a spreadsheet that we're looking at. It's not just a news article that we're reading. I mean, these are families, these are people who've had lifelong impacts. So thank you so much for sharing that. Retha, I'm going to come to you for that question, just kind of coming on the heels of what Malcolm just shared. You know, from your view and with the work that you're doing, who needs to be at the table for this to work? I mean, families like Malcolm's and others, you know, who else? Who are the other stakeholders? And how critical is it? I think I know the answer to this based on everything that I've heard so far today. How critical is it for the community to have a voice in the solution?
So first of all, you know, it's hard to come after Malcolm. He gave such a powerful answer to this question, but I'm going to try. So first of all, I believe there are different tables that you need to be a part of, and there are tables that you need to set up for yourself. So I mentioned before, I'm a community organizer. And so from a community organizer perspective, first of all, you need to have community organizing tables for problem identification, solution development, strategizing, planning, organizing, more mobilizing, and holding people accountable, right? And the folks who need to be at this table are the folks that Malcolm mentioned, right? All the faith leaders and civic leaders and educators. But you also need to have non-traditional leaders at the table, right? People who feed children in the community, but they may not have a 501c3, right? They may not go to church. They may not be part of a Greek organization, but they should be at that table. Formerly incarcerated or, you know, former gang members should be at the table, right? This is the place where you really should engage people in the community. This is a place where you empower the community to act on their behalf and make sure that they get the services that they need. Also, community members should be engaged in discussions with law enforcement, partners and governmental agencies and elected officials, right? This is where you have discussions about system level changes, new legislation and policies. And of course, community investments, right? How do you talk about moving money away from incarceration and moving it back into the community, right? You need to be sitting at the table with elected officials and folks who can make those decisions. And, you know, first of all, most important, you know, folks who are impacted by gun violence need to be part of all decision-making tables at all levels of government. Sometimes you need to find where those tables are because you never know where the decisions are being made. But you need to also make sure that you're a part of, you know, city council meetings, state agency, task force discussions, state budget discussions, congressional hearings. And then I think the last one I'm going to mention is that, you know, there needs to be a critical table around talking to folks who have been harmed by violence, right? We're talking about restorative dialogues, places where you can establish, you know, a safe space where people can talk freely about healing and restoring and reconnecting to the community and being able to provide feedback to the public health strategies in the system to make permanent changes for them.
Wonderful.
I think that's it.
No, yeah, but you said a lot. And I think that what the part that I heard from you, Retha, was how we need to be intentional about those conversations, right? I mean, it needs to be strategic in terms of who you have where and making sure that the different parts are hearing from the other stakeholders, and that's important. And, you know, I think that I'm hearing consistency in terms of we know who needs to be involved in these discussions. We know who needs to be there. So now I want to ask this tough question of, okay, so then why isn't it happening? Why are these connections not happening? So in your opinion, so I actually want to come to Daniel first on that one, and then I'm going to come to you, Eric, for your thoughts on it. So Dan, what do you think? Why aren't they happening?
Yeah, it's the $1 million question. When I think about this, you know, in the years that I've been doing this work, researching and teaching and being part of the Gun Violence Center at Rutgers, a lot more of my time now has been spent just trying to listen and understand what people are saying that they need and where they need it from. And so the more and more I talk to people about why these kind of groups can't all get at the table, there's a couple of things. One is, I think that people, you know, whether it's local or state level leaders, don't understand the true scope of this problem. We're talking about gun violence as a public health issue, right? But everybody in the room, and some more than others more intimately, know that there's this huge ripple effect when a person is shot or is a victim of gun violence, right? They not only experience, but their families, the community members, everybody around them in their communities. And, you know, a lot of the research that I do shows that community health is poorer where there is more gun violence in those communities, right? So to appreciate the scope that this has, my argument would be you have to bring all of these stakeholders together, and to do that, you need a central office of violence prevention and reduction at the state level that is responsible solely for bringing together the infrastructure necessary to have an enduring conversation and enduring capacity to be able to do this regularly, right? A lot of states and different jurisdictions rely on different police departments, different task force, different community leaders in different cities. And oftentimes what I see in New Jersey is at a high level, leaders in one city don't necessarily know what is going on in another city or vice versa. New York community, the New York City street team is doing, you know, incredible work there, but we've had a harder time filtering that into Camden and knowing exactly how that can work and how that can affect, you know, improvements to gun violence issues in Camden. And so other people have made the same argument that if you at a state level have a body that can hold up to people leaving and entering positions, to funding fluctuations, to the ability to know who the major players are and who needs to be contacted regularly, that is a stable entity that really gives meaning and dollars to the scope of the problem that we're talking about. I think that at the federal and state level, we continue to underestimate how much of an impact this is having on people, how important it is to address this. And that requires real money and real investment to an enduring body that can address this, and not one that is part of or part and parcel of another office that might not get funding in the next year, that kind of thing. It has to be something that has stable investment. So in addition to the politics that may keep groups, you know, separated from one another, which is going to happen everywhere, I also think it's an organizational issue that really needs to be addressed.
You know, it's interesting what you touched on in terms of the ability to you know, for states to consistently have that central office that's responsible for it. It's not kind of here today, gone tomorrow. It's, you know, this is we're making an investment as a priority in this infrastructure being an important part of the infrastructure. So it's surprising that with the scope of this issue, with the dollar impact to this issue, with the real lives impact to this issue, that's not done in a consistent way. But maybe that's where it's moving. You know, maybe that's where things are going. So we can definitely be hopeful. Eric, what are your thoughts so far in terms of what's the barrier?
Yeah, man, it's I think it's ego, right? I think you know, a lot of times, you know, in this work, people want the credit, right? Like, you know, when I think about going to a certain city, which I won't name, to try to do some work there, to try to get this city, you know, up and going with a public health approach to reducing gun violence in the community, you know, I had the sheriff come up to me and basically say, you know, why didn't we check in with him, you know, when we came to the town, and why can't we work together? And, you know, things like that. And I think there's a misunderstanding. I think the brother who just, I think his name is Dan, was kind of alluding to this, but people don't really understand, right? Like if the players that really make the best impact, the most impact, right, in this work, the credible messengers, right, these violence interrupters, these outreach workers, these people who are on the front line, if they are seen to be talking with or sharing information with the police, they can die. Right. I mean, police know that. I mean, they have informants for a reason, but they know, like, if an informant gets caught, they know they're going to have the risk, the potential to die. So to me, it's a little idiotic to think that, you know, anything else would be you know, in this work, like thinking like violence interrupters can share information with the police, then this becomes a police informant kind of program and not, you know, what it really is. And the reality of it is those two entities can let me back up. People say that they want to end gun violence. Police say they want to end gun violence. We say we want to end gun violence. Well, the analogy that came to me in this work is, well, we're going in the same direction, right? They have a lane and we have a lane, but I'm a sports guy, right? So even in track, if you're in a 7-lane track and you cross over into the other lane, what happens? You get disqualified, right? So you can still go in the same direction and not crossing anybody's lane. So police have a job to do, and we have a job to do. I think when we talk about people not coming to be able to, the stakeholders, the groups of players can't come together, I think it's those type issues, you know, that need to really, really be addressed. And those are some of the barriers that keep it the way that it is.
So there's so much to unpack in that, and in a good way, because you know, you're speaking truth. And I saw a lot of the nods and you know, the nods up here about, you know, folks, it's not status quo. I mean, if you're really trying to move this in a certain direction, everybody has to kind of stay in their lane, because you're right. I mean, there is a real danger there for people who may get involved and to be seen as supporting, even though their goals may totally be aligned. There could be some impact to doing things in a transparent way, in terms of how you're acting. So I thank you very, very much for that. I saw some nods, so I didn't know if one of you wanted to add to that.
I totally agree with Enrique was saying. You know, when you start looking at some of the multiple organizations that's doing it, ego does get in the way, because a lot of times people think is, oh, my way is the best way, and they don't want to either team up or partner up, and this causes roadblocks. It really does. It's too many small fires to handle a huge, you know, a huge thing. So that was one part I feel like is an issue. And then also, as Dan was saying, it needs to be permanent legislation that funds gun violence, period. As we keep saying, it depends on what administration is in. They're going to commit this X amount of dollars, that X amount of dollars to gun violence. And it's like, whenever there's a hot topic or the sexy thing to get reelected, this is when our politicians or elected members want to start putting in money to it. So just as much as they want to defend our Second Amendment's rights, they need to continue to put permanent legislation for gun violence and intervention and prevention inside of every state legislation.
Have that set. Have that set.
If I can add just one quick note about the barrier as well, to enhance what Eric already said, is that many in law enforcement don't understand the language of public health. And so part of it is ego, that they're in charge of law enforcement, but the language is not the same. So public health language is different than law enforcement language. And so root cause analysis, trying to figure out what is going on, their root cause analysis is to get to the offender, to identify who initiated the gun violence. Our root cause analysis goes a little deeper as to why. And so it's not just ego, it's just a lack of understanding too, as to the role that public health, it does have a legitimate role in addressing that violence that comes up. Law enforcement believes that they have purview over violence. And so, I don't want to pit us against each other. It's not about that. It's about helping law enforcement to understand that there's a role that individuals within that public health space have to be a part of the long-term solution, not incidental solution.
Wonderful. Okay, so like I said, I told them earlier, I was like, y'all gonna get me in trouble because y'all pulled me into because this is good stuff. And I feel like we need to have a couple other summits to get to some of these other things. But let me go to my next question. So we recently partnered with the Root Cause Coalition to conduct a national survey on gun violence and the perception of gun violence. It was really interesting. Some of it was probably what you would expect. So the responses revealed that Black Americans, Americans under the age of 45, and individuals living in urban areas are most likely to say that they or somebody that they know have been affected by gun violence. And that could mean directly, they could just be aware of it, et cetera. So what does a public health approach mean for different types of communities who've experienced gun violence in different ways, especially those already being affected by economic or health disparities? So Dan, I'm going to come to you first on this one.
Yeah, so I want to lead the response to think about this more granularly to others. So I want to talk about this just a little bit of a high level to get a sense of proportion. You know, some people will think about gun violence as this big problem that affects the entire country equally. We have a 25 times higher gun rate than the next peer industrialized country in the world, right? It's absolutely insane. Children are now dying of gun violence as the #1 cause of death in the last couple of years. So you can think about these as very high level kind of big statistics, but when you look further into them, you start realizing that Black and Hispanic children in those death rates and Black and Hispanic communities are far more disproportionately affected by gun violence than you would see in these much larger statistics. And so when I teach my class on gun violence, the first quarter of the class is talking about how cities have developed as a product of racial and economic segregation, and how that has developed cities and is one of the root causes of gun violence. You cannot talk about gun violence and how it affects communities without talking about segregation and inequality, right? And so the results that you got from the survey don't surprise me at all, because despite these big national statistics, they really obscure the fact that communities of color that are already socioeconomically disadvantaged are far more likely to be affected. And so when we know that, and we know that this is a relatively small number of neighborhoods within cities, you have to then say, well, then where do we put our resources, right? Where do we put those dollars for a gun violence center at the state level? Or where do we put public health dollars in terms of prevention strategies or street outreach in particular neighborhoods? And you have to put these resources in the place that are being inequitably affected, that are disproportionately being harmed. And, you know, we could talk all day, I think, about what the right approach is, and many others have said there are egos and different people have different ideas of how you can address this. But one thing I think most people would agree on is that if you can come to an agreement on what the approach is and how to enact it, there are certain places where those resources need to go far more than other neighborhoods. And, you know, this means using a prevention style approach that engages public health, but also providing victim services and healthcare for those that are exposed to gun violence. And again, this is going to be socioeconomically disadvantaged communities of color. That is not surprising to anybody in this room. But that means taking that very seriously and treating it with the kind of equitable approach that it deserves.
Excellent, thank you. Christopher, what do you say about this one?
Yeah, I was biting at the bit for this one. I appreciate you calling on. Thank you. So I think it's 6 degrees of separation, just like what we're going to be hearing, right? So like most of us who have been, well, I would, the benefit of the doubt is all of us who are working on this either live, know, are connected, and, you know, have some experience, right? So I'm a gun victim survivor. I have a unique position of being appointed by the governor and also being formerly incarcerated. And so it's an interesting dynamic when I see children in the Inglewood communities of Chicago or Austin or West Garfield, Roseland areas. Those children are impacted by the firearm violence epidemic that is happening, right? The way they move, like we went to a 2nd grade class, my provider, when I was wearing my direct service provider hat, and all our 2nd graders knew someone, knew by name someone who had been shot. All of them knew someone who was incarcerated. This is an epidemic that is you know, got into every fabric of our life. And so when our young people who are, you know, have symptoms of PTSD transition through life without the proper health supports that they need, it's no surprise sometimes where we end up at. The other part, it erodes the will of elected officials and community members, right? People get so tired, and I think this is a success of the crack law, right? Where people were so frustrated and so tired that they can pretty much, let's just throw any solution at the problem in order to get rid of it. And, you know, I think there's a different will now, but when this impacts communities to this level, people want to throw their hands up, and I think it's frustrating. And that level, the part, and I understand that throwing your hands up part, but you know, we want to recreate the narrative. The other part, what I was saying, would be the disinvestment that happens in communities as a result of firearm violence. Communities, corporations don't bring forth their resources. Hiring opportunities are nil. And so you get this perpetual sign of violence continue to happen because the community, the city, the county, and oftentimes the state have given up on those places that have been impacted by firearm violence the most.
And that's that ripple effect we were talking about earlier. That, you know, the disinvestment that begins to happen and how that ends up with some of the structural inequities that we see. So Malcolm, I'm going to come to you for this question. So why do you think, I mean, what does a public health approach mean for these different types of communities?
Public health, I think a public health approach is like multi-pronged. Again, this is a global, I think, a wraparound services that we all need. You know, one, you start with trauma-informed training for victims of gun violence. Excuse me. Then we do prevention services for young men and women who are most susceptible to engage in gun violence. You know, when you start looking at some of the children that goes in these neighborhoods, they escape some of the gun violence simply by going to school. So, you know, some of them are lucky by their travel going to school, and some of them lucky going back, coming home from school. But what happens to the ones who aren't lucky? So these, you know, we need to continue to invest in after school programs that's really, that gets our children off the streets. We also need to provide education and training for post-high school students where they can get an opportunity to learn a trade or a higher degree of education. Because again, college is not for everyone.
Right.
But what we need to understand is a lot of times gun violent offenders or gun offenders are between the age around like 17 to 22, right? And it goes back to what I was saying about high school. A lot of times our children go to school, they escape, and then they go to an underserved school in an underserved community, and then they graduate without a plan. And then now I'm 18 years old, and what am I do?
Right.
Where am I going? I don't have a plan. You just ushered me through, and now you pushing me in the ocean to swim. And we need to provide some type of some training and some education to those children. I'm sorry, to those young people to prevent that. And then also you need some mental health and behavioral services for those who are frequent offenders. And then also the housing issue. Again, goes back to that. We got to make sure that affordable housing just is quality housing. It's just not 4 walls and a roof. You know, it really needs to be an investment into these lower income communities where they can see that the neighborhood is not blight, that there's more out there. Because again, if you come out of your home and it's not invested in and it looks terrible, you're going to adopt that mentality from time to time. So you know, that's my answer for that.
Okay, perfect. Retha, what are your thoughts in terms of a public health approach?
So I believe an effective public health approach means that you have to try to understand the community that you serve and focus on cultural competence to inform trauma-informed care and violence reduction. You know, something that Christopher said that really resonated with me, and that is that people want to, you know, throw all kinds of different solutions to the problem, and you really can't do that. You really need to understand the nuanced intergenerational issues within the community. Service providers need to understand how communities interact with the health system, particularly after gun violence, and, you know, folks who commit violence or provide or do violence on other folks have been harmed. So you need to look at it holistically across the folks who harm and the folks who don't harm. You need to really look at how folks access healthcare, their willingness to seek out healthcare, particularly after violence happens in a community. You need to understand how and unpack how Black and Brown folks mistrust the healthcare system, and what do you need to do to make sure that they can gain the trust and seek out support that they need.
You know, really, it's interesting because as we talk about these systems that are intersecting that already aren't working, or they are not trusted by some of the communities that are impacted the most, it makes me, you know, I'm trying to remain optimistic about where and hopeful about where we're going. And I think we should. I think we absolutely should, because I think there are lots of indicators to show that there's movement going in the right way. The part of me that gets sometimes a little frustrated is if all these systems are intersecting, you know, we don't have time to fix all the systems. You know, how do we then at that intersection, which was where we're seeing a lot of these disparities, including this epidemic of gun violence, it makes it even more complex to try to address, because you can't just address the issue, to your point, you have to look at all these other pieces. And Malcolm, I think you said it several times, this really kind of this holistic approach, but it makes it challenging. It makes it absolutely challenging. So thank you all for your responses on that. Daniel, I'm going to come back to you on this question, and it's about some of the information we saw in that same survey. And it showed that older Americans are more likely to say that law enforcement is a significant factor, while younger Americans, and this was across multiple different races and ethnicities, stated that healthcare is more important. So I think we've heard that come up. But there are very, very different stark differences in the data about where the emphasis should be. There wasn't a conversation on funding or anything like that, but just programming, interventions, et cetera. So how do you implement a public health strategy with such a different perception from the community of where the need is? So I'm going to come to you first, Dan, just in terms of what you're seeing in the research. How do you approach that? What's the best way to approach something like that?
I think this has to do with what you were saying right before you asked the question, which is thinking about how different intersecting systems, you know, can work together, and then the barriers to making that happen. You know, the one way to think about that is like, how do we fix policing, or how do we fix healthcare to be able to address the issue of interpersonal violence in the communities that are hit the hardest? And that's a really big, tough question, right? I mean, it's almost insurmountable to say, how do you affect and fix an entire institution? So it's not surprising to me that you might have kind of different age of people who are saying one is better than the other. I think a better question is, how can what we have work to address what we know is actually driving gun violence? And we know, like I said, it's a relatively small number of people in particular communities. And we also know that a major driver of gun violence, based off of especially the stories I'm hearing today, is cycles of retaliation, right? Where you will have an incident and then a retaliatory incident. And that's what a lot of street outreach and interruption is about. It's trying to break that cycle and change norms, right? So I think that there is a role both for, you know, community engaged policing and healthcare systems to address that particular dynamic of retaliatory cycles, where if you have a hospital-based program for somebody who is the victim of a shooting, and culturally competent workers who are there at the bedside of a person who has been shot, there is this kind of what I've seen described as like a come to Jesus moment, where you can get at that person and say, look, now is not the time to retaliate, and break the cycle at the bedside. But there's also the ability for law enforcement to use different approaches that do not mean incarceration, do not mean going to jail, but identifying the people that are at risk of engaging in violence and saying, look, pulling aside and saying, we can provide X, Y, and Z services, but if we find out that there's shooting happening, then there are going to be consequences. And that's kind of a pulling levers or focused deterrence approach. Doesn't work though if the community is not engaged and on par with working with the police, right? So this isn't asking to fix police or defund or extend funding or whatever police. It's not asking to fix, you know, big, deep-seated cultural issues in healthcare. It's saying, what programs can be in place in both of these institutions to address that very particular dynamic of retaliatory shooting that keeps a lot of shooting cycles going? And so that's how I like to frame it, so that I don't get really overwhelmed when I'm doing research, or this is how I've heard it framed when I'm actually talking to people who are more engaged, because it helps make you a little more confident that things can change down the road if you address in smaller kind of chunks.
And I like the way that you said that. And Rita, I'm going to come back to you on this as well. But first I wanted to say that, you know, when you're looking at the just that exact scenario that you spoke to, which is the retaliatory situation and kind of how to intervene at the bedside, so to speak. And even with that approach, I come back to, I think, some of the things that Eric touched on, as well as Malcolm, in terms of engaging the folks who have been impacted by this to help to even inform that process. Because, you know, you think about it, and you know, I kind of think about some of my own experiences, you know, where, you know, someone's going back into the community. If someone's sitting by the bedside and say, okay, well, you know what, don't act, don't do. And that emotional moment is very difficult for people to hear that. And so to have someone to talk to you now, you know, I'll share, you know, we're sharing here just between us and a couple hundred other people who are listening, just, you know, that's our little private discussion. You know, I had an aunt who was murdered by her significant other. And what our family was told and my cousins were told was, do not do anything. You know, let us handle it. It's going to be okay. And that is the right thing to say. That is absolutely the right thing to say. And in that moment, that's not what you want to hear. And so I'm just thinking about someone who themselves, you know, were shot and felt violated, and they don't necessarily know how to process that emotion, especially if it's a young person. Then what is the right combination of resources to bring to bear to address it, to your point, Daniel, at that bedside to stem it? You want to say something, Eric?
That's what I did at Grady Hospital down in Atlanta. And it's really called the golden hour, right? It's that critical moment when they've gotten shot, when they're at the bedside. It's the golden hour that you have to be able to capitalize a decision change or a life change, right? So, I mean, you have to be skilled. You have to, you know, be sensitive to the environment, you know, first and foremost. And what I used to do, honestly, y'all, was I would go in their room the first visit. I would write on a sympathy card, get well soon, praying for your recovery, and have my business card in it. I would go in their room, introduce myself. Hey, I'm Eric, da-da-da-da-da. You know, I just came to bring you this sympathy card. You know, my information is in it. If you're up to it, I'll come back and holler at you tomorrow. And I will come back the next day, right? It wouldn't be about, you know, me trying to get them enrolled or me to get them to change their life in that first moment, because I want to try to build some type of rapport, some type of trust, and some type of buy-in with this individual to let them know that I care. And to be honest with y'all, probably about 75–80% of the people who were victims in the hospital, my sympathy card will be the only card in their room. So that let me know, like, they don't have, if they do have family, they don't care enough about them to come visit them in the hospital. So that moment that I have with them is very, very, very critical, and I have to take advantage of that. So that's kind of the approach. And the sister online said culturally competent. I think, you know, that's huge when we talk about allowing people to, you know, make a decision change. I can remember being in the hospital, one of the nurses, me and one gentleman was talking at bedside, and I mean, we was rapping, you know, and talking how we talk. And so she looks over and is like, oh my gosh, are you guys speaking English? And I'm like, I don't know anything other than English. It may be broken sometimes, but, you know, I don't know much other than English, you know. So I pulled her outside and was like, listen, you know, like, that comment was so inappropriate, you know, like you cannot do that, you know. It's further traumatizing for him to be laid up with 6 bullet wounds for you to talk about, are we speaking in English? Right. So it's those type things for me when we talk about this.
Perfect. Thank you. So Rita, I want to come back to you for that question. And we're talking about this, right? Perception and what we're experiencing. So how, in your view, does a public health approach work within this disconnect of perception? Eric just touched on something really important, you know, in the bedside, next to the bedside, somebody saying, you know, are you speaking English? But that's just one of the areas. The research revealed something else. So how does a public health approach work within that context?
Yeah, so I think that we really need to be intentional about having intergenerational discussions about public safety, right? Folks from the different generations need to get into a room and talk about what does public safety and public health look like going forward, right? For example, different generations need to get in a room and co-design first responder models, right? And it will be a great exercise in the community to talk about switching crises response from a punitive law enforcement, you know, perspective to one that is more healing and trauma informed, right? That includes violence interrupters and, you know, health providers that are attuned to what violence practices, violence reduction practices are in the community. And I think there could be a good opportunity to come to an agreement across generations on how to actually move to the next generation of, you know, first responders and you know, violent interruption and different practices that we're doing right now. And I don't think there's very many forums in which we're actually doing that,
right,
and talking in an intergenerational way.
That's an important point because I mean, the language is different, right? I mean, you're talking about costing generations. When I'm talking to my kids, some of the things that are priority to them and things that they're centering, I'm like, okay, I don't get it because it doesn't sound like my experience when I was your age. But it's important to listen and to hear it and to try to bridge that. So Malcolm, I'm going to come to you for this one. So then we've talked about all these pieces, and I think we've kind of nibbled around the edges on it. And in some cases, have said it outright. You know, what does an effective model really look like in terms of public health? I mean, in your opinion, what would that look like? And then what is the role of proper messaging in communicating that model? Because we've talked about people don't really speak that language. So what does that look like? And then what is the role of proper messaging, do you think?
It's a good question. When you start talking about proper messaging, you know, just listening to what Enrique said, you know, Enrique, I'm sorry, I apologize. Enrique, I do apologize. What he's doing is very, very, very necessary. You know, having a trusted messenger, having someone that's competent and trained in the situation to come speak to those who are victims or perpetrators, right? And, you know, I look at that and think about what happened with my story was that type of resources wasn't there.
Right.
You know, and as a child, who do you identify? Who do you talk to? How do you, when you said, you know, when your aunt was unfortunately murdered and they said not to do anything, how?
Right.
Teach me how not to do anything. How can I not be retaliatory? How can I not have this anger inside of me that I want to respond? And you know, and it comes with, you know, the resources that should be provided to them at that bedside, right? It should be instantly, a whole team should come, you know, just as the GSW get reported into the hospital, the police is automatically there, a police report is, boom, all the responders, mental health, behavioral health, everything should be there. Grief counseling, because that's necessary. What saved my life from not responding is, you know, my parents started to see that my brother and I, who was in the store, we started to go down that road. We started to feel like, okay, this was what happened, and so this is our environment. And what saved our life was she sent us to a boarding school, military boarding school. So at the age of 10 years old, I'm at a military boarding school until I graduated from 17. But a lot of people don't have that resource. A lot of people don't have that access. And if it wasn't for those resources in that military school, providing you with a great education, good housing, good environment, I could have been another repeat offender.
Right.
So that the packaging of that is, you know, once it happens, it should be an automatic response of all types of treatment, and that messaging should come from, you know, the hospitals, the healthcare, and to our legislators that will fund these types of programs.
Very good. Thank you. Thank you very much. Eric, what are your thoughts on that same question? What does an effective model look like, and what's the role of proper messaging?
I think he really kind of hit it on the head. I believe that an effective model, you know, is one that it does everything we've been saying, right? And you're talking about the right fiscal agent that has the money, right? That can hire the right workers, because what happens a lot of times, even if you get the funding, well, some agencies, they don't hire convicted felons, right? And so it's like, okay, well, how are we going to effectively do this work? Because, you know, while I like the brother on the screen, I'm a formerly incarcerated as well, but we clean up well. The brother on the guy on the screen, you know, he's working for the government. Like we clean up well, you know. I have a degree and things like that, and I can come and speak to you guys. But a lot of people don't clean up well, you know, who are effective in this work, right? And because they don't clean up well, they don't get the opportunities you know, to be able to get these positions, to be able to make the changes needed in these communities. And so we need to start with the fiscal agencies, right? So, and that's what a part of my job is when I go around the country is, you know, I vet these agencies to see, what does your mission look like, right? Does your mission align with this public health approach mission? That's number one. Because if your mission, which is all great and it's all good, is children's behavioral health and adolescence and all of that, that's good, but that's not this violence prevention work, because somebody who's going to appeal to the kid, the 5-6-year-old, is not going to talk the same language as going to appeal to the 17-year-old kid that's shooting. Right? They're going to cuss and they're going to do all this. And they might smell like weed. And, you know, it's not appropriate for a 6-year-old, right? So we're starting with those fiscal agencies. Then we're looking at the right workers, right? So the public health, it doesn't start with the agencies. We got to look at the right workers. So are you credible, right? Credibility is great, right? You are who you say you are. But there's another coin to that. Are you suitable? So do your days match your nights? You know what I'm saying? So are you out here talking about cure violence, you know, by day, but then by night you still moving packs and calling shots? No, that ain't suitability. So that's the other piece that goes along with this job. So it's not just, you know, anybody can do this work. Not saying just because you went to prison, you can do this work. No, they might not be suitable. So they don't need to do this work, because now you're doing more damage than you are harm to the holistic approach. Because now people are like, you shouldn't have gave them thugs no jobs, no way. You see, so we look at all of that. We're looking at the agency, we're looking at the right workers, you know, and the right communities, right? So like you guys talked about Camden, and I'm from the South, so I don't know much about up north. This is my first time up north, to be honest with y'all. I've never been to New York ever in my life, so this is the first time I've been up this far, right? But in Georgia, in Atlanta specifically, Buckhead is a nice community, right? It didn't make sense to have a violence prevention work program in the city of Buckhead. Although Buckhead, well, in Buckhead community, because it's part of the city of Atlanta, although Buckhead was experiencing some high volumes of incidents, right? Car break-ins, jackings, things like that. Why? Because Lenox Mall is right there. But that don't mean y'all need a violence prevention in your community, because historically, the data shows that the violence program needs to be in PUV with Mechanicsville, Summerhill, Dare Park, places like that. So the right community. Don't just set these programs in communities because, oh my gosh, we've had, you know, 3 break-ins and what are we going to do? You know, like, that's historically what these communities look like. So we're looking at the right fiscal agent, the right workers, the right communities. You know, all these elements come into play when we talk about a true public health approach, you know. So I'm gonna pause with that because I feel like I got excited.
No, look, bring it on. Look, Nation, I know you about to jump out of your chair. What would you add to that? Woo! We're on fire. Let's keep it going. Let's keep it going.
Eric has touched on some points that are just on point. First, let me say as an aside, I attended Morehouse College and took MARTA to Lenox Square. That's where all of the AUC spent their time. And yes, I am very familiar with some of the stuff that happens. So, and I live down in Riverdale, down south of Atlanta, where there's a little cluster of stuff. So let me get to this question, because this question is so on point. This is not going to look like everything else.
Right.
So public health attacking violence won't look like a program that's looking at diabetes or heart disease or even tobacco prevention and control. It has to look full, comprehensive, and it has to include elements that don't look desirable. And so it must break down, tear down some of the institutions that have been around for decades. But let's remember this. Where did all of this come from? We look at the history of our cities. A lot of the communities that we're talking about were the same communities that were the most affluent communities in the state, or in any state that you look at. And after the civil rights riots took place, there was white flight. We all know this. And those same communities that were sought after, that had the best schools, that had the greatest resources, that had industry, that had jobs, that had everything that you would want in a community, all of it left. That was intentional. Let's not fool ourselves about it. It wasn't a mistake. It was policy that was driven by government officials. So we have to reverse that. You have to put the money back. You have to put the jobs back. You have to ensure that educational institutions are real, that they actually are leading young people to careers and leading them to lives that they would be able to sustain themselves. You don't just cover it up with small amounts of dollars and you're going to put a little program in there and you're going to have after school programs and everything's going to be great.
Right.
You have to invest in it. And so the conversation that we are having here is just so important. Dan talked about institutionalizing long-term investment and having an office that is dedicated to this and keeping the funding there. And Malcolm echoed that. I agree with it. I work in state government and I know that unless you have those dedicated funds, you can't do this work. But more than funds, you need everyone at the table. You have to have it driven that it is a high priority that isn't going to go away because an administration changes. And the administration of the time is all about, you know, hardcore law enforcement, you know, at all costs and lock them up. Unless we get to this place where we value every resident of this state, we're not going to make this happen. And so what does it look like? It looks like having programs that are focused on community education, things like tourniquet education, so that if someone is shot, what do you do immediately to ensure that the person doesn't bleed out and die on the street? What do you do to ensure that lock boxes are available in communities? They don't have to pay for it. We're going to give them out. We're going to make sure that gun locks are there in the community, that the guns are going to exist. We in the United States like our guns. We're not going, let's not delude ourselves. Guns are not going anywhere, but they need to be stored and maintained safely. Third, we need to make sure that, and we've talked about this multiple times today, the hospital-based violence intervention programs, they're evidence-based, but they've got to be done right. And Eric has talked about some of the ways that you do it right. It is counseling, it is education, but it isn't just simply while the person is laying up in the hospital. It has to be long-term investment in that person. It has to be when they are discharged, what do they go back to? You have to make sure that the investment in them is for the long haul, that they get the resources that once they are back out in the street, that they're not returning back to the natural instinct, which is to retaliate. The other piece of this that I think is important, and we've talked about this as well, is that the wraparound for individuals has to include pieces like ensuring that, you know, the infrastructure within the community exists. I saw something recently, and I'll get off of this because I could take the whole day on this. The New Jersey Economic Development Authority just announced a piece that many probably did not even notice. The governor is investing funds in addressing food insecurity.
Saw that.
And what he's doing is that he's supporting the idea that we have to create supermarkets within communities that are vulnerable. It is unbelievable and unconscionable that cities like Newark have 1, 2, 3 at tops supermarkets. The largest city in the state has 2. I think now they didn't have, when I was in law school, any. They have a shop right now and they have a Whole Foods. But where are they located? They're located in the central ward where you have all the money, where you have the people that will go to a Whole Foods. Where are we in the parts of the city where the true long-term residents of the city live? And in places like Camden, where you don't have a supermarket, in places like Atlantic City, what are we doing? Those are not only places where people can get healthy food, but they're jobs. For goodness sakes. You know, we need to be thinking that, you know, people need to have quality jobs that have benefits, that have, and they're not the highest paying jobs, but they are jobs that people can actually make enough, barely, but they can make enough that they can actually buy the food in the store. But childcare, the other resources that people will need to be able to work, childcare needs to be available. And we need to look at it in a way that makes sense. Don't base it on the bare minimum poverty level. You can't live in New Jersey at the poverty level. So let's stop with these policies that are just setting limits that where people it doesn't even make sense that people would even be eligible for them, because the second they get a minimum wage paying job, they're no longer eligible.
Right.
So all of it works together.
Look, look. Whew. Let me tell yes. So I want to hear, Christopher, your response on this. I'm gonna have one more question, and we may have some time for a couple of audience questions. But Christopher, let's hear from you on this, especially from the Illinois view. What does an effective model look like for you, and what's the role of proper messaging?
You know, I think, so I appreciate it. So it's all above, right? It's everything my fellow panelists mentioned and more. Now, what we've seen with our beginning of, say, street outreach work here in Illinois and Chicago, it was 10 years ago, 15 years ago, 20 years ago, we were doing street outreach and violence interruption. We weren't talking about trauma-informed care. We've transformed and evolved into that. We also added, because of the fact that we understand that adding a network to an individual's life added value to that individual's life, right? So like when you look out the window, the only network is not the gang for the group or the organization that's outside their window. And so what we added here in Chicago was the case management, along with street outreach, victim service folks who could use violence prevention or that opportunity as an, while the bedside component existed, but also trauma-informed care. And then lastly, I think we'd be remiss to say the level of investment that we have to make for people who are on the front line doing street intervention work has to be in par to what we're giving participants on the street. That means men and women who are making up the outreach professional across the country. I don't want that to be a dead-end job for them, right? And so in many cases, because some of us come from the streets and some of us have been formerly incarcerated, our skill sets, our soft skill sets are limited, right? And so you're often asking someone to go out there and help someone else make a resume, and they don't know how to make a resume themselves, right? So Word, Excel, email etiquette, understanding trauma-informed care, how it impacts, people. I think giving the tools to our professionals so that they can be the best themselves as they approach their participants and save our communities.
Excellent. Yeah, we need to have a couple other summits on it because, look, let me tell you, y'all really feeding my spirit today. So this is my last question, and I want to put it to all the panelists. And Eric, I'm going to come to you first, and Nation, you're going to be second. But what is your hope regarding, and just give it to me quick, what is your hope regarding the next steps in progressing this issue? We've talked about everything that needs to be done. Based on what you see and where we sit, what is your perception on the next steps to progress this issue within the context of public health? What needs to happen?
What needs to happen? Well, I'm hopeful. I will say that because, again, I kind of mentioned earlier that there's a lot of money just with this administration. I mean, billions of dollars, like nationwide. So while this is my first time on North. 2 weeks ago, I was in Portland doing some work there. And what I'm seeing is, it's people have access to these American Rescue Funds, right? And the CARES Act money, and they're able to, and one thing that I will say that I'm not political at all. I vote, but I'm not with a political party like that. But one thing that I will say that I like about this particular administration is he put that it had to be attached to evidence-based program, right? So you're talking about community-based, hospital-based, so I'm hopeful, because, like my colleague said, they work, right? I mean, I'm not a scientist, but I'm not even good in science, but what I do know is if something is evidence-based, that means that it works more times than it doesn't work, right? And that's the whole basis of it. And so for me, I'm hopeful because there's funds available for people to access, right? And I know there are programs out there, models out there that work, that are evidence-based, where I guess my doubt kind of comes in a little bit. It's just there are not a lot of local, not a lot of local agencies that have had access to the federal dollars to be able to get that. Because it's kind of like when I was younger, they used to say, it takes money to make money. So if you don't have no money, that kind of seems kind of crazy, right? And same thing with this particular instance, like it takes them being able to have access or have gained or have proven themselves to be good stewards over federal dollars a lot of times to get access to new money. And so that's where my only doubt kind of comes in, is that there are not a lot of those, because around the country, you know, they're really not a lot. And what happens is these city entities, government agencies, health departments, things like that, they have the funding, and then they have to hire, you know, the workers. And again, those barriers that I mentioned earlier kind of come into play with that, with some of the policies. So I'm hopeful because there's funding available, and I think holistically there are people who can do this work. My only doubt kind of comes in is just the implementation piece on the local level. So
okay, perfect. Thank you. Nation, what do you think?
My hope is that in this moment where we have a unique opportunity, there's attention being paid to this, and it's being translated into funding. As Eric has indicated, this is unusual. This will not remain the case, and we need to take advantage of it immediately. I also want to say that it is important that we take some of the lessons learned from the COVID pandemic. We didn't think in government that we were able to do things with agility and with due diligence, and to tear down barriers between agencies, between public and private sector, but we were able to, and we have done it effectively. And so we need to take those lessons learned and apply them to this public health crisis, which is a priority, and we need to make it work and not take years to do it, but we need to make it work, take advantage of the funding opportunities, and pull all parties together to bring about comprehensive change that will address and end a lot of this systemic violence that we're seeing.
Perfect. Thank you so much. Christopher, what are your thoughts?
Echo, I think that, you know, I'm excited to see, you know, I referenced a few times the evolution of street outreach work and where we were, you know, then to now. I'm excited to see where we're at in 5 years. You know, and the reason I mention that is because street outreach and violence intervention programs have, while they've been around for a long time in a lot of places, they don't have the same momentum and need of urgency that like other systems in government have, right? So to see this model adopted into local governments, larger governments, and completely funded and supported would be, you know, where I'm excited to see us go.
Okay, thank you so much. Retha, what's your hope?
I'm gonna have to repeat what everyone else said here. So I'm very excited and hopeful about the amount of money that's being spent in this area. At Salvation and Social Justice in Trenton, last week, we just officially launched our Trenton Restorative Justice Hub with 7 partners in the North and West wards, developing 7 satellite locations to address violence intervention and to connect folks in the communities to services. And that's primarily based on funding that's coming down from the state and at the national level. So I'm hopeful that we can implement some things that we've been talking about for years in Trenton, and to follow the footsteps of folks like in Newark doing the Newark Street Team, and in Patterson. With their help, we can really put together an evidence-based programming so that we can continue to get funding, not just in the near term, but long term.
Thank you, Retha. Dan, what are your thoughts or hope in terms of next steps?
Yeah, I'm hopeful because I think more than ever before, we're starting to know what works. I think that this was a black box for a long time, you know, far before I started doing this work, and I'm sure, you know, before others too, but we didn't fully understand, you know, maybe what the causes were, what the dynamics between people and groups were, and how those were leading to retaliations and cycles of violence. And, you know, a panel like this really shows me that when you bring together people from different walks who have different types of experience, you can identify the things that work and actually the programs that can be implemented, right? The Newark Street Team, you know, has been effective, and there are interventions that have been effective in a number of different cities, despite the increasing homicide rates that we've seen over the last 2 years. So as a researcher, that gives me hope. As somebody who cares about implementation and actually making this better and helping communities, that stuff gives me hope. I reserve the same, though, concerns as some of the others, is that Biden's Build Back Better plan, which is supposed to give, you know, $1 billion+ has not passed the Senate, and it probably won't. And so even though there's funding in states like New Jersey and some places like this, in other states, they're having a lack of funding for implementation of the things that we know could actually work. So I'm very hopeful that we know what to do, and we know the steps that we need to take to get there. But I am still concerned that, you know, we are of the moment now where people are putting money at this, and if we don't have something more permanent in place, it will fall to the wayside when it stops becoming a quote hot topic to certain people.
Absolutely. Thanks, Dan. So Malcolm, I want you to bring us home on this. What are your hopes for next steps?
So my hopes is a little contrary to what Enrique said. He's non-political. I'm very political. As a former chief of staff to a state legislator and also a former director to a congressperson, you know, it comes down to permanent legislation. We talk about Build Back Better. We talk about the funding that's there. This should be the standard moving forward, and hopefully we can continue to put in office legislators who agree with this, right? We shouldn't be sitting here talking about, oh, certain congressperson, certain senators not passing a gun violence bill that helps everyone. Like, that should not be a question or a issue. So one, hopefully we are bringing in more elected members who understand what's going on. And then secondly, my hope is from this is that when we start talking about the funding that's coming down, larger nonprofit institutions like the one like PHMC that I work with continue to work and partner with those organizations on the ground. You know, when you start to have folks like myself in the room and these gentlemen right left and right to me in the room and on the panel, we are able to pull in the organizations that's more impactful, that's on the ground, because we understand the culture, we understand the background, we lived it, we worked it, and we're here and we survived through it. So my hope is to bring more people in these conversations into the table, in these rooms, to help bring in these nonprofits that's impactful, to help disseminate some of the monies that's appropriated to these gun violence.
Perfect. Thank you so much. Now, so those are my structured questions for the day. I think we might have time for one, and Carrie's probably giving me a look over there, maybe two. One or two questions from the audience. So Rachel's going to help us out with that. Rach, do we have any questions?
Communities that want to take this approach.
Can you say that again, Rachel?
Is there money available for communities that want to take this approach?
So I'm not sure who wants to take that one, Malcolm.
I can take one. I know that the Philadelphia, that's where I'm from, the Office of Gun Violence Prevention, and the mayor has also allotted millions of dollars for community organizers to, have gun violence prevention, and a lot of the nonprofits have been putting in for it. And what we've been learning is that, again, I think you covered that, the back end support, the data, the actual standing up of it for larger institutions are starting to partner with that. So the money is out there. Organizations like PHMC is out there to help out those communities as well. So yes.
Okay, perfect. Thank you. Do anybody else want to add to that, or?
Okay. Just a brief part of this is that in New Jersey, we have, through the Attorney General's office, the hospital-based violence intervention program. And so it's working with, I believe, 9 hospitals throughout the state with regard to their specific efforts to address some of the concerns in the way that Eric indicated, where it's working with individuals who are victims of crime and of violence. It's not just gunshot, it's also other violent hospital inpatients, so stab wounds, gunshots and the like. And their program does work with institutions across the state. I also do want to shout out Dan and the Gun Violence Center at Rutgers, because that is a unique feature here in New Jersey. There aren't many states that have that. And so I'll yield to Dan to talk about the work that they do, but we are very, very very blessed in New Jersey to have a gun violence center out of Rutgers, our premier state university here.
Retha, were you looking to say something, Retha, or?
Melissa, I just wanted to mention that Governor Murphy put $10 million in the 2022-23 budget for community-based violence intervention. And he's proposing to put another 10 million in the next fiscal year for violence intervention programming.
Excellent.
So there is a commitment here, so that's very hopeful.
Okay, excellent. Thank you so much. Do we have time for one more, Rach?
Do. Last question. If leaders in my community don't seem to be paying enough attention to violence that's happening, how can people get involved?
Interesting.
Vote.
Did you hear me? Said
Vote.
vote.
But also, yeah, take the initiative to create, your own community-based organization and show up at their door. Honestly, I've worked in these offices where these groups come in to pull the state reps' attention, to pull the Congress members' attention, to say, look, this is what we're doing. How can you help? And then that raises a lot of attention, and they will help. Sorry.
Okay.
We can't normalize violence. And so I think making sure that communities know that there should be no normalcy in violence being in communities, in certain communities and not in others. And so I think part of it is making sure that as a collective, that we're not okay with that. Living in my community, I grew up, as I told you, in Neptune, and the Neptune-Asbury Park area, that's considered a zone of violence in New Jersey. And historically, that area was the beach area for the affluent, not just for New Jersey, nationally. Before Florida was Florida, where you had all of the Disney and all of that, Asbury Park was the most popular beach in the country, outside of the West Coast. And so, it's really astounding that we have gone through such an evolution or devolution, that communities have been left in such bad state. And so I think all of us should be concerned about that, and not because we've lost a beach, and not just because we want to be able to go back to those towns, but we should all be concerned when any resident of our state, we should be proud enough of our state that we want every corner of our state to be a desirable place for anyone to live, to work, to play. So that should be where we're working with community members to engage them, that all communities should be communities where we want to have the postcard that used to say, welcome to Asbury Park. We want to say, welcome to all of our communities.
Thank you. Thank you so much. So I think I'm out of time, or we're out of time. This has been so absolutely wonderful. Please join me in thanking our panel, both virtual and in person. Thank you so much. You've all been so gracious in giving of your time and your expertise today. It is so appreciated. And please know this is only the first step. We will be reaching out to you again. We will be reconvening in different ways. And I think that we all are locking arms in moving this forward and not letting it end here. So I want to thank all of the attendees, both in person and virtual, for your time today and for taking the time to learn about this even more. And we hope that you will add your voices to the chorus to moving this to a continued public health issue. I want to just remind everyone that you will be able to access an electronic version of this presentation. I have no idea. I think it's going to be at ascendainstitute.org. Thank you, Carrie. ascendainstitute.org. So please check it to be able to download and share with others who maybe want to want to be educated about this as well. So again, I thank you all for your time. I thank our amazing panel for your input today and for all of your time and graciousness in being here. So thank you. I think they're going to be able to hang around for a little bit if anybody has any questions for them afterwards. But again, thank you all so much for joining the Ascenda Institute of Health Innovations chat today, merging science with safety.